Welcome. Welcome. Hi, everyone. How are you doing, Leslie?
Doing well. How are you?
Good. And I see that we have Caribbean Broadcasting Corporation on the line with us. We are Facebook Live. We want to welcome you to the Caribbean COVID-19 Town Hall meeting. Donna, can you reach out to Lisa for me?
Okay. Hi, Andrew.
Hi, Dr. How are
I'm
you?
doing well, thank you. Let me send you Dr. Dixon's information so you'll know him when he calls in. I'm going to be live streaming from your page onto my page as well.
Right, so you're seeing it live streaming now, right?
Yes, I'm going to check it. And then is Pure Jamaica live streaming, or do I need to live stream onto them as well?
You put a live stream on to them also.
Okay, all right. So I'm going to, hi everyone. I'm going to mute out a little bit and take care of that.
Yeah.
Okay.
Welcome, Ambassador Gilchrist.
Hi, hello.
Glad to have you on the call.
Thanks for the invitation. Glad to be here.
And happy belated birthday.
Thank you. Thank you. I have to celebrate when all of this is behind us.
I know. Saturday after we finish with this, we're going to have a cocktail, virtual cocktail.
Happy belated to you too.
Thank you.
Welcome.
I have my team on the line.
Okay, great, great.
Welcome, Ambassador Thelma Brown Phillips. How are you?
Where is she?
Ambassador?
Good afternoon.
Good afternoon, Ambassador Philip Brown. How are you?
I'm fine, thanks. How is everybody?
I'm good. We have Ambassador Gilchrist on and the team from Authentic Caribbean Foundation.
Okay.
Hi, ladies.
Hi. Good evening.
Hello, everybody.
Hello.
Hi, everyone. Good evening.
Hi, hi.
I didn't expect to be on so early.
Yeah.
Half an hour before to get everything running. I need some light.
Hello, hello, Madam Pierce. Madam Pierce? Yes.
Andrew, I'm going to mute myself, okay?
No problem.
Yeah. Okay, later.
Okay. All right. Okay.
Welcome, welcome all our participants who just joined us on the Caribbean COVID-19 Town Hall meeting. We're so glad that we're listening to some great pan music. Hi, Mr. Cross, how are you? I'm good. Just checking in to see have you been able to connect? I'm very good, you know. It's
Hey everybody, I'm
I'm
Darlene.
telling
I'm
you,
Emily.
this
And
COVID
let's talk about why
virus
a
is
great domain name
crazy.
is your superpower on the web. A great business name and a great domain name have a lot of things in common. Right, and they don't
Yeah.
have to match. They don't have to be identical. Your business name does not have to be exactly what your domain name is.
I
Yeah,
sent you
exactly.
the
There are
direct
a few
link,
things you
so
want to
just to
keep in
click
mind.
on it.
Short, simple, and memorable. Now that you've got your domain name registered, you need to put it to work right away. And there's a lot of different things you can do with the
Yeah, it's been split up with some of the we you know we most of, yeah, most of it's gonna be done in the Q&A. Yep. Welcome, welcome. So I'll come off the phone. I'm not a minister. Thank you.
Andrew, I sent you Dr. Dixon's information so you can log him in when you are ready.
Okay, perfect. You WhatsApp it or
I sent it via WhatsApp.
perfect. Yes, Lisa. No, everyone is on. It's just
Dominic? Okay, I found the page. Andrew.
I'm sharing it onto other groups.
Yes. Yeah, I'm going to share it onto our page now and into the other groups.
Yes, you're on, Ambassador. Were you able to connect?
No. I got online as requested to.
Have we started yet?
Not yet.
Oh, so are you hearing me, please?
Yeah, I can hear you.
Oh, wonderful. This is Eunice Lafayette.
Hi, I'm Dominique Bruce.
Good.
I'm a member of the foundation.
Wonderful. And what is your name?
Dominique Bruce.
Oh, okay.
Good afternoon. This is Ambassador Smith from Grenada. I'm not on the panel, but I'd just like to listen in. Good afternoon, and I hope everybody here is safe. Thank you.
Good afternoon.
Good afternoon, Ambassador Smith. Good afternoon, Madam Eunice.
Good afternoon.
Good evening.
I'm Ambassador Luann Gilchrist, St. Vincent and the Grenadines.
And good afternoon. I'm Ambassador Philip Brown, St. Kitts and Nevis. How are you?
Hi, Telma.
I'm good. You are good? You okay?
Doing good. Staying home.
Okay. I know. I'm just here as since we haven't started. I was just looking at Nauru, which one of the few countries that don't have coronavirus, and the president was saying the Lord gave him the scripture, and it starts Psalm 147, verses 13 and 14. So I'm going to look for it. 147 verses 30. Oh,
Go ahead, take this ticket. I just want to.
We got 29 people in the group already.
Well, anyway, let me get to the call. Hey, hang up, man.
All right.
I can't even find your calls.
You want me to hang up?
Yeah.
All right. All right.
so Andrew, how come you're not having Ambassador Smith present? Where's he? Mr. Sharp?
Ambassador.
Mr. Sharp,
Yes, Ambassador.
how come you're not having Ambassador Smith present? An update on her.
Ambassador Smith.
Yeah, well, those in shadow, we will have to go through that.
All ambassadors are speaking, is it not
because,
so?
Yeah.
there are a number of those goods that have already expired. Plus,
I don't see Ambassador.
Andrew, I think he's
well, as far as I see,
Ambassador
it's
came
going to
on
be
and
difficult to
said that
even,
he's not
because
presenting.
you have a lot of dust on it. There's a lot of pigeon droppings.
That's
Yeah, I would
Ambassador
have
from
preferred
which
that
island?
didn't go out at
Ambassador
all. But
Philip Brown.
if they're willing to
Grenada.
go through it, they got to unpack the pallets.
Is he on the
And
line?
we wouldn't be able to send them out on the pallet just
Key,
yet.
sorry.
We
I'm
want to
sorry.
see the pallets that are expired.
I'm trying to.
She's
So we'll
online.
have to,
Okay.
I'm not seeing
if we're
her.
going to go through, we're going to have to unpack everything and repack it on other pallets.
Oh, Ambassador Smith, thank you
But
for
as it
coming
is,
on. Definitely we would
not
like to
necessarily.
get
I
an
mean,
update
as
on
it
you.
is, they know it's looking really poor. It look,
You
as I
see,
say, if they're
like,
willing,
only
if
we
they're
learned
willing to
about
go
this
through
just
it
a while
and
ago,
choose
so
out
I
what's
can't
good
say I'm
in
prepared
between.
to present.
Yeah, because I how it is.
If you could mute Ambassador in his
Someone with a background noise.
Exactly. Yeah. Yeah, I think we could just condemn that and done because
Who is that? Somebody still
it's really looking
somebody.
poor. It's really bad.
Okay, so could you put
Dr. Nelson? I want to welcome everyone to the Caribbean COVID-19 town hall meeting, and we want to welcome the ambassador. Anita, are you on?
Hi, everyone.
And we will commence in the next 3 minutes.
Okay.
Andrew, excuse me, is this being streamed? Where can I can put it on my Facebook and then we stream it?
It's on our Authentic Caribbean page.
Okay.
So I'm just going to do a roll call. I'm going to do a roll call.
Very good, no problem.
Hello? Hello?
Welcome.
Hello?
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 Hi, Ambassador Lynch.
Ambassador Lynch is on mute. We're not hearing you, Miss
Okay,
Michelle.
can you
Michelle?
see us?
Okay. We're seeing you, Michelle, Ambassador Lynch.
Okay.
We're hearing you too. Okay.
You hear us now?
Yes, Ambassador. Andrew, Ambassador Lynch is on, please.
Ambassador
Barbados.
Lynch, welcome. Glad to have you on.
Thank you very much.
What I'm doing is unmuting. Ambassador Edmonds, welcome from St. Lucia.
Thank you. Thank you.
Ambassador from the Bahamas, Ambassador Coley, welcome.
Thank you. I'm here. Thank you.
And Ambassador Smith from Grenada, welcome. We're so happy to have you.
Thank you very much, but unfortunately I won't be able to participate as a panelist, but I'm definitely on as a guest just to listen.
Perfect.
Good afternoon. This is Dawn Cochrane.
Welcome.
Thank you.
Welcome, welcome. Welcome all participants. I'm just requesting for everyone to mute except the ambassador, Dr. Nelson and Karen Dunkley, and our speakers. I'll ask everyone to mute except for the ambassadors and our speaker, Dr. Karen Dunkley and Dr. Claire Nelson, the team, and Minister.
Problem is we won't be able to see well, we can see it from right here, but if you want to see the gallery.
I don't need to see these people. I just need to know names.
That's the thing. You can see the
The
names.
countries. I'm just putting the countries. I'm not putting. I heard St. Lucia, Bahamas, Grenada. That's what I heard.
What's in
St.
the
Vincent and the
flyer?
Grenadines is here as well.
St. Vincent and the Grenadines is also here.
Yes, Luan Gilchrist.
Ambassador Gilchrist is on the line also.
Hello.
Welcome, welcome.
Hi, Andrew.
Welcome, Katie.
How are you?
Good, good.
Good, good.
Once again, I'm going to ask everyone other than the ambassadors, the ministers, and the speakers, Dr. Claire Nelson, Dr. Dunkley, and Dr. Trevor Dixon, and Dr. Anthony Campbell Fonte, all other participants, please mute.
Andrew,
yes.
Mr. Sharp, may I suggest that we all remain mute except the person who's called upon to speak?
Yeah.
Yes, thank you.
Thank you, Ambassador.
Andrew,
Yes.
just mute everybody, please, because people are still moving around, and just unmute. Okay.
Yeah.
We're ready?
Yep.
Okay, let's go.
Hello, everyone. Warm welcome to members of the Diplomatic Corps. Wish viewers, Caribbean Foundation.
Are we not hearing you?
You're not hearing me?
No.
Can you hear me better?
Yeah.
Warm welcome to members of the Diplomatic Corps, distinguished guests, committee members, Facebook and Instagram viewers, ladies and gentlemen. My name is Anita Mortley, and I am a member of the Authentic Caribbean Foundation. Thank you for joining us today for our virtual town hall meeting for a Caribbean COVID-19 update. Special welcome to Minister Jocelyn Crows from Aruba, Ambassador Sydney Colley from Bahamas, Ambassador Noel Anderson Lynch from Barbados, Ambassador Hervey Dennis from Haiti, Ambassador Dr. Thelma Phillip Brown from St. Kitts and Nevis, Ambassador Anton Edmonds from St. Lucia, and Ambassador Lou Anne Galen Gilcrease from St. Vincent and Grenadines. Any questions that you may have, we will have a Q&A at the end of the discussion. So please post your questions in the chat. Please remember to follow us on Twitter, Instagram, Facebook, and LinkedIn at Authentic Caribbean Foundation. To lead us off in our program, we will have a welcome from Andrew Sharp, the chairman of Authentic Caribbean Foundation. Dr. Nelson, president of the Institute of Caribbean Studies, a roundtable discussion with our Caribbean ambassadors, medical experts, and ending with our Q&A and closing remarks. Andrew Sharp.
Ambassadors, distinguished guests, bon tarde, buenos dias, bonsoir. Good evening, ambassadors, distinguished guests, committee members, online viewers, our partner in Philadelphia, our partner in New York, Miami, New England. We're so glad that you are here with us, my fellow Caribbean nationals and friends of the Caribbean. I'm Andrew Sharp, the chairman of the Authentic Caribbean Foundation, a nonprofit organization based in the Commonwealth of Massachusetts. I open the words of singer, songwriter, activist, and actor, Arabella Fonte, Island in the Sun. This is my island in the sun, where my people has toiled since time began. I may sail on many seas, the shores will always be home to me. O island in the sun, willed to me by my father's hand. All my days I will sing in praise of your forest waters, your shining sun. The words of Arabella Fonte truly resonate. My love for the Caribbean community, especially those with disabilities. My journey began years ago, but in 2012, a major milestone was achieved with the formation of the Authentic Caribbean Foundation. a nonprofit organization, 501c3. Our mission is to offer assistance and provide resources to our Caribbean and Caribbean American kids with disability, along with advocating for minorities within our midst in the state of Massachusetts and the greater New England region. As a foundation, we continue to soar with our heads high while representing our Caribbean communities through programs, festivals, and events. This virtual town hall meeting is another planned venture with the Caribbean community in mind, along with the Philadelphia Caribbean community, the Institute of Caribbean Studies, and the West Indian Foundation. The aim and focus of this meeting are to ensure our community is kept abreast with the happenings of events and how it is affecting loved ones in our home island. Hopefully, at the conclusion, our people will be more aware, consoled, and encouraged that they are not facing it, this pandemic, alone. Time will not allow for all the issues and possible solutions to be discussed. However, the panel of distinguished ambassadors will offer information that hopefully will put some mind at ease. I'm gratefully pleased to have such a wonderful team volunteering their time and effort for a worthy cause. So I pause to say, thank you, team, thank you. The Caribbean has always been resilient through natural disasters, economic issue, and now the virus, COVID-19. Authentic Caribbean Foundation is proud to host our ambassador and guest speaker at this Caribbean COVID-19 town hall meeting. Encourage everyone to play a role, get involved to build a strong and sustainable community, both here in the United States and the Caribbean region. I thank you. And it's with great pleasure that I hand over the floor to Dr. Claire Nelson.
Thank you so much, Andrew. Everyone, good evening, ambassadors. All protocols observed. I'm going to be very, again, hopefully polite in saying, people, if you're moving around, this is a very sensitive system, and we're hearing a lot of movement and pattering in the background. If you could please, if you're moving around, just the visual of you moving is very distracting. Turn off your camera. If you're doing other things while listening, could you please mute yourself, because it's making it difficult for us. As we jump into it, we have a very packed schedule. We have a lot of ground to cover. Just want to say to everybody, thank you for the all ambassadors for taking time to join us and to bring your perspective, because obviously over here we're just hearing news, and jabs, and a lot of conspiracy.
Come on. So, how do I cancel me? They want me to cancel me?
Someone, can you mute, please?
If you're on a phone, you press *6, I believe, or #6, please.
Okay.
It's a nightmare. Okay. Andrew, you may have to mute everybody and just leave me speaking for the time being. But very quickly, as a result, lots of things have been happening here as well. Just to bring people up to speed from.
Hold on, Dr. Nelson.
Thank you. Just to bring everybody up to speed from our Caribbean perspective, is that in one of our calls with the Jamaican community, we have been hearing that in New York, which is an epicenter, a lot of Caribbean American people are on the front lines and are dying in huge numbers. And so as diaspora, we now have to work on two fronts. We have to work on a domestic agenda as well as on our international agenda in terms of focus. So this conversation will bring everybody up to speed as we organize local, what we are calling local response, recovery, and regeneration teams in the Caribbean American community, as well as those people who want to work on the U.S. foreign policy agenda. I just want to put out this conversation is also very important for us to listen to as we prepare the diaspora white paper for presentation to State Department as we come to the end of the first 3-year U.S. 2020 strategy and engagement. If you don't remember, the law, Public Law 114291, basically says that the State Department should respond to and consult with Caribbean diaspora as part of its preparation for its strategy. They're at the end of their first 3-year strategy, and we are preparing a white paper, and we'll be doing that in the next 4 weeks. And so this conversation is very important to help us prepare our remarks, hearing firsthand what we want to see happen in the health pillar from a Caribbean diaspora standpoint. We can lend our voices to the what the countries need from us as advocates and citizens here in this country. So without further ado, I want to move it right along, hand back the mic to the moderator, and you'll be hearing from me at the end as I do the what next session. Thank you so much for the opportunity, Andrew, and thank you again for taking the lead. And one of the things we decided, we did do a workshop on Saturday with a core group of Caribbean American leaders who form part of ICS leadership circle, and we'll be repeating that workshop to build this out as part of our Smart Caribbean, Smart Futures agenda. And we decided that we really wanted to have a distributed leadership response. And so, Andrew, thank you for jumping right in and leading off. We want other people from Atlanta, those of you from South Florida listening, to understand that it's time for us all to come to the table with our own leadership qualities and work as a collaborative whole to make things move much faster. We have to move at warp speed. So with that, Andrew, I turn the floor back to you. Thank you so much.
Thank you, Dr. Nelson.
Thank you, Dr. Nelson. Leslie, how do you feel about COVID-19's effect in the Caribbean?
Anita, it's a great time of uncertainty, and I would love to hear more about what our Caribbean governments are doing.
Well, let's hear from our ambassadors today. Donna, who do we have to speak to us first?
Donna, who do we have?
She may not be on the call.
No, we're going to hand it over to Minister Jocelyn Croy from Aruba. So we have Aruba. The minister will give us an update on what's happening in Aruba, COVID-19. Minister, you have the floor.
How much time do they have, Andrew?
Each person 7 minutes.
Okay.
Hi, Andrew. Hi, Claire. Thank you very much for organizing this and for this opportunity. I'm eager to hear from our fellow islanders, how they are doing. We hear very little what the Caribbean is going through. You hear more from Europe, you hear more from the States. And sadly, I think we are the most impacted, not only by the virus, but by the economic impact of this. As for Aruba, we have been in lockdown since March of 2020. So the moment it started, the moment that we got our first positive COVID patient was mid-March, 15th of March. The government took precautions right away. We started with a total lockdown. With a total lockdown, I mean, we closed our borders for inbound passengers. You can just imagine what that means for an island that lives 90% out of tourism. If you drive around today in Aruba, all the hotels are empty, all the restaurants are empty. We have pretty much no economy going on since 15th of March. As for how we stand on health, I must say that the Prime Minister of Aruba acted took all the precautions. We are following WHO protocol. So we started with a shelter in place. When the cases started going very rapidly up, our positive patients, she introduced also a total shutdown. and that is from 9 p.m. to 6 a.m. So it's a combination of shelter in place in the morning, having only the grocery stores open, and pharmacies and doctors. Today, how do we stand? We have 97 positive patients. Of those positive patients, 50 are active, so the rest is at home. They're feeling better. They are now negative. We're very happy with that. Sadly, we do have 2 people that died of the COVID. We started with 12 ICUs. And thanks to the help of the Netherlands, today we have 33 ICU units. So we have enough ICUs to cover the population of 110,000. We have seen, I think we have pretty much reached our peak. We're going down now. We only are getting like 1 case every 2 days and going down. So I think we handled it properly. So now we're putting all our emphasis on the economy. We calculated that it will mean a deficit in our national budget of $1 billion US. So working on that, we also think it's going to cost 25,000 Arubans, 1/4 of our labor force, to be unemployed by the end of this month. So we are now feeling the economic impact of it, and we think it's going to last, according to our calculations, it's going to last until June before we think we can even start reopening the island and getting the economy going and the tourism going. And then we still depend on the US market, so it depends when they open their borders. And I think most of the Caribbean islands are going through the same thing. What I would love to see, because I saw that was one of your questions, what I would love to see the Caribbean islands do, because what we realized during the COVID is that we are extremely dependent on only one economic source, which is tourism. We don't have food security, and I think most of the Caribbean islands deal with the same problem. We import most of the things that we consume, we import. I would like for the islands to be more resilient, work more on our local economy, more agriculture, more food security, circular economy. And in these times, you see how dependent you are on the foreign economy and foreign imports. So maybe it's time for the Caribbean islands to unite and see how we can produce fruits, vegetables, sell them to each other, have more flights between the islands, have more shipments between the islands, more import, more export, keeping the money flowing between the islands. We have so much in common. So that's one thing I would love to see the islands do, work more together in trade, help each other with expertise, knowledge. We share the same expertise, tourism, agriculture. And lastly, I would love to finish on a positive note. The islands are resilient. They have gone through many hurricanes, many natural disasters. We have not caused this. We are a victim, but we have always been the most resilient of all. And we will overcome this if we work together, if we stick to the WHO rules, we keep social distancing, even when opening our borders, keep social distancing, protect health goes above anything. So health before economy, and try to have the islands work together, and we will prevail and we will come out of this positively.
Excellent. Thank you very much, Minister Jocelyn Cross from Aruba. Go ahead, Anita.
Okay. Next we have Ambassador Sydney Colley from Bahamas.
Ambassador Colley, welcome.
Thank you very much. I think I've been unmuted. Good afternoon, everyone. I want to begin by saying how grateful I am to Authentic Caribbean and their partners for sponsoring this virtual town hall meeting and for including me as a part of it. At the outset, I wish to congratulate Authentic Caribbean and all of the participating ambassadors and speakers from the region. I also take this opportunity to welcome all those participating and observing this webinar throughout the region, with a special shout out to my Bahamian brothers and sisters. COVID-19. According to today's agenda, this forum is called to focus on the Caribbean's COVID-19 update. The brief background is that it got its genesis on the 31st of December 2019 when World Health Organization was informed of a cluster of cases of a pneumonia-type illness of unknown origin detected in Wuhan City in Hubei Province, China. The virus is a member of Corona family of viruses, which was named COVID by the World Health Organization. Over the last 3.5 months, the virus has blanketed the globe, affecting and infecting over 184 countries, 2.5 million confirmed cases, and 600,000 deaths. The entire Caribbean region has been impacted. Life as we know it has been changed forever. A new world order is on the horizon and will impact life as we know it for the foreseeable future, similar to September 11, 2001. Caribbean folks are very familiar with natural disasters and the impact of global recession, but it is predicted by the experts that in the aftermath of COVID-19, the world will experience a new normal in a changing new world order. Caribbean governments and peoples must now prepare for economic stagnation, attendant austerity measures in order to combat what is to come. The Bahamas. The outlook on the short and medium term for the Bahamas is no different for the rest of the region. The Bahamas situation is only unique to the extent that it has to now deal with a three-pronged dilemma. The aftermath of Hurricane Dorian, the ongoing challenges of COVID-19, and the onset of the 2020 hurricane season. As you are all aware, the Bahamas is still in the throes of recovering from the aftermath of the country's worst natural disaster in a generation, some say in its history. Hurricane Dorian ravaged the islands of Grand Bahama and Abaco, the country's second and third highest GDP, respectively. Conservative estimates of $4 billion damage will take 3 to 5 years to recover. Small island developing states, SIDS, like the Bahamas, which include all of the Caribbean countries, will now have to battle the uncertainties of a global pandemic while simultaneously preparing for the 2020 hurricane season, with no guarantee of what to expect for the impending economic challenges to come. Much like the countries in the region, the government of the Bahamas has had to take strong measures to mitigate the impact of the health of the nation arising from COVID-19. One of our first challenges has been assessing PPE. Like a few of the other countries in the region, the Bahamas was blindsided when a shipment of PPE exiting the port of Miami, bound for Nassau, was blocked and ordered to return to Miami. Apparently, the Customs and Border Protection officials interpreted an April 3rd presidential order intended for U.S. local market very broadly to include export as well. After a series of diplomatic engagements, we were able to rectify the situation and have all the shipments released. The experience has forced the Bahamas Ministry of Health to source PPEs from many different vendors from around the world. The Bahamas government has taken the following measures in the immediate aftermath of the announcement of the pandemic. The Governor General invoked the emergency powers order under the Constitution to declare a statutory state of emergency for 2 weeks. The government implemented a dusk to dawn curfew. The government closed all of our national borders to air, land, and sea with certain exceptions. The government ordered a stay at home for the past month, and yesterday it was extended for another 14 days with the real prospect of further extensions. The government implemented all of the now famous social distancing protocols put in place by WHO. The government implemented special provisions by the Ministry of Health to treat the critically ill COVID-19 patients. The government made mandatory suspension of non-essential businesses and closure of those businesses. The government had a closure of all the traditional schools and limited implementation of distance learning. The COVID-19 statistics for the Bahamas as at the 20th, yesterday, of April 2020, we have a total of 651 in quarantine, 64 confirmed cases, 11 recovered cases, and 9 deaths. In conclusion, I wish to observe that not only have our nationals at home been severely impacted by this pandemic, but also too has it affected members of the diaspora for all of us, with very special challenges for our students, temporary residents, and those in transit. In this regard, I am particularly grateful to Authentic Caribbean and other similar like-minded regional organizations who have not only shined a light on the numerous challenges, but in a million different ways have reached out to these nationals in distress, including all of the regulations, the consulates, and members of national diaspora groups. Thank you very much.
Thank you so much, Ambassador Coley from the Bahamas. Anita, who else do we have?
Next, we have Ambassador Noel Anderson Lynch from Barbados.
Good afternoon, all. Can you hear me?
Yes.
Good afternoon, all. Let me begin and echo the sentiments expressed by the 2 previous speakers to really thank Authentic Caribbean for taking the initiative to convene today's virtual town hall meeting. I believe it is through areas like this that we can really start to share the information, and that creates the capacity and the coordinating measures that we really need as Caribbean people to handle this situation. As it relates to, and I'll begin first with Barbados and tell you what's happening at home for all those who are listening who may be resident in the United States, and tell you what is happening in Barbados. There's been a shelter-in-place action taken in Barbados since March 15th. Now, there is a strict curfew in Barbados from 6 p.m. to 6 a.m. in the morning. And then After that, people are allowed to go about their business in terms of essential services, obviously supermarkets, pharmacies, doctors, etc., your dentists. And that happens from 6 a.m. to 6 p.m., but under very strict conditions. It is actually done in alphabetical order, depending on the alphabet, where your surname is in the alphabet determines whether you actually go out or not, and what days you actually go out. Now, this is important because Barbados has handled the situation, and the health officials, in my opinion, in my estimation, have handled this particular issue very, very well. I want to also begin by complimenting all of the frontline workers, all of the health workers for the outstanding job that they're doing for Barbados. Yesterday, for the 5th straight day in Barbados, there were no new reported cases. The 4 persons who were tested negative for the second time yesterday were among 28 negative test results that were returned by the public health laboratory. This brings the number of persons who have recovered from the viral illness in Barbados to 23, while another 47 remain in isolation. A total of 75 persons in Barbados, obviously our population is only 280,000, have actually tested positive for COVID-19 since the first case was diagnosed on March the 16th. Of these 5, regrettably and sadly, of those who were tested, 5 have died. Since February the 11th, the Public Health Laboratory has conducted some 1,063 tests. The fact that Barbados has recorded 5 straight days without any positive tests, I believe is testimony to the outstanding effort that is being given by those public health officials who are working in the communities and particularly doing contact tracing. It is also a result of the level of cooperation and support that we have been having from the general public in Barbados. Those persons who have been presenting themselves, those persons who have symptoms, and those persons who have simply been cooperating, following the public health advice, have been putting out over time. However, these positive tests is not a sign, even though encouraging, is not a sign that Barbados is yet out of the woods. In our opinion, we simply just need to maintain our guard. We must not drop the level of defense that we're putting up against this particular enemy. And Barbados have still got to continue to be on their guard. Ever since the testing has started, Barbados, the government has managed to source the resources that were available to them. Several weeks ago, with only about 500 tests available to them at the laboratory. As a result of that and the hard work of the government, we've now been able to have as many as 27,000 tests available to us in Barbados if we ever need to be able to do so. Clearly, Barbados is working assiduously to ensure that they cover all eventualities, including provision of quarantine and isolation facilities. And I believe that it is, again, testimony to the hard work of not only the government, but how our people in Barbados have been complying. Now, just let me say that this is, and Dr. Nelson asked for the white paper what exactly we're thinking about doing and what can we do. As tourism-led economies, which have always shown signs of high unemployment, persistently low growth across the Caribbean, obviously there needs to be a stimulus to start the ball rolling in terms of tax ease, in terms of being able to keep Barbadians at work, to keep things going. Now, just let me say there are a number of people who have expressed the view that this is either a health crisis or an economic crisis. I believe it is a fallacy to think that there's a trade-off between healthcare and the economy in this particular fight. I do believe that they're both sides of the same coin. And if you don't have a functioning economy, well, then clearly you don't have the resources that you can devote to healthcare. We can't lock ourselves out from the rest of the world, as we are a tourism-led economy, and most of the countries in the Caribbean are. Our focus has got to be, how do we continue to work together? The economic aftermath of this particular crisis is expected to last maybe a year or more. And from all estimation and from what the scientists have been saying, we may not be back to some degree of normalcy until maybe even June. anything that we need to do must be sustainable and must be sensible for the long term. And all countries need to be both psychologically and physically prepared to handle this. The question that we need to ask is, how do we reboot our economies? How do we handle a sustainable posture, for example, as tourism-led destinations, for maybe a new protocols for travel? Those are the things that are important. But in addition to this, I think the COVID-19 situation has demonstrated more than ever that the source of the country's income revenue streams, I think, in the Caribbean must be further diversified. I think for too long we have been running on one or two planks that has been the mainstay of our economies. And the traditional productive sectors that we've got, we can even do more to expand those particular sectors. Additionally, I believe that a greater national focus needs to be paid to food security and in creating new sunrise industries that can create new and different jobs for our people. This is going to be critical to our development. And what better time to be able to focus and to do this than during this crisis? It is imperative that we identify new and emerging sectors that can propel and expand the economies of the Caribbean. I've had occasion to say in the past that sunrise industries are where we really need to focus our efforts. Sunrise industries are characterized by those in which physical aspects can be connected to the digital world and the convergence of industries which are underpinned by data and technology. Examples include breakthroughs, for example, in machine learning, artificial intelligence, cybersecurity, privacy, preserving data, sharing applied to financial services, for example, and personalized health and nutrition and energy storage. Anything that you can take physical assets and link them to the digital world is particularly important. But this may happen easily in our schools to be able to train some of our youth. But the unemployed, people who might possibly be displaced during this period, is where we need to concentrate our efforts. How do we create a basis for retraining these people as quickly as possible to be able to do some of the things that they wouldn't normally do or wouldn't traditionally have done? And I believe that this is more than ever an opportunity for us to create a kind of Marshall Plan, for example, that happened in the United States after the war, a kind of New Deal. And I think that the Caribbean Development Bank and some of the other entities, these international financial institutions that we so much depend on, they should be at the center of creating some of these real new areas that we can deal with. Economic diversity, food security, a resilient health sector, and focusing on these new sunrise industries for new job creation. This is not going to be an easy time for any of us in the coming year or so. But I do think that we have started the ball rolling. Again, I wish to thank Authentic Caribbean for what they have done for us. Obviously, when you do open your borders, I think we've got to remain eternally vigilant, because if this thing is going to be with us for maybe even over a year, it means that cases will pop up, clusters will pop up. How do you handle things like on border control, contact tracing, isolation, and treatment? We need to stay ahead of the curve, and we need to invest even more in our people during this very, very difficult time. I'm going to stop there because I know there are many other people that need to speak. But just to say thanks again to Authentic Caribbean for convening this town hall. Thank you.
Thank you so much. And next we have Ambassador Hervey Dennis from Haiti.
Ambassador Hervey, not hearing you.
Is he here?
Yes, he is.
Andrew, he's muted.
I unmuted.
They get 100,000 and they get another 100,000.
You hear me?
Yes, I'm hearing you now, Ambassador. You can go ahead.
Yeah. Well, they won $1 million. till they, ran through 1 million of them.
Hello, so could I go?
Yeah, you could go ahead, Ambassador.
Okay, good evening, everyone, dear colleagues, and my special thanks to the.
Here's the thing, if we say yes to this, then we'll have a.
Sorry, someone can mute, please. Someone in the background. Sorry, Ambassador. I'm muting.
Yeah, my special thanks to the Authentic Caribbean Foundation who held that virtual meeting. And concerning Haiti, we have 60 cases registered with 3 deaths. And unlike the other country, Haiti has few because we don't have too many foreigners visiting the country. But the first day we realized there was a registered case, the government, the president of Haiti announced that they closed the country. So until now, the country is closed, the border closed, and no flight except few one that from United States that send his airplane to take the U.S. citizen. They establish a curfew from 8 p.m. until 5 a.m., which is mostly respected in the urban area. But unfortunately, in the rural areas, this is another topic. The people continue doing the habits and even go in the band, like a cultural band. So we feel a lot for the future. But so far, we have those 3 dead registered. We have people that are among the well-known people that in Haiti that had the COVID-19 and has been cured. And I would like maybe to share with you some a doctor that has been cured and the medication she takes. And maybe that you could maybe share that with your technician. This is a chloroquine. This is augmentin, which is an antibiotic, and azithromycin, which is another antibiotic, and that has been in the very well-known hospital. So maybe that piece for the chloroquine, maybe, I say I'm not a scientific, maybe can be investigated because somebody from Haiti has been cured based on that combination of those medicine. Now we have also established a task force beside of the Ministry of Health. There is a task force and we have somebody very well known that helped in the epidemic of HIV and well known working at Cornell University. And it is a very, Dr. Pap is the head of that task force. And I think with Dr. Pap, we get connection with the international community, the scientific community. This is a good addition to the fight against the COVID-19 in Haiti. Beside of that, we continue with all those quarantine reserve. But if we don't register so far too many deaths, this is another topic when come the diaspora, Haitian diaspora, living in United States mostly. And we have maybe 2 million of Haitians living abroad in the US. And we registered a lot of death among them. A lot of them are working in public transport like taxi or hospital. So they are very exposed, and unfortunately, we deplore the death of a lot of them. So maybe my advice, we can share that, because every country need the same kind of tools to fight against that deadly virus. So we placed an order for 18 million in mainland China for equipment. I wonder why the country from the CARICOM, we don't put together sometime resources and to order, maybe the foundation can take care of that, or maybe this is a proposal, and maybe and try to get those kind of equipment we need, medicine we need, and with a common fund, maybe, because this is after all the same thing people are looking for. In meantime, there is also United States that has voted certain through the USAID certain fund for countries. I think maybe your country respectively received something. But on the other hand, also, this is another issue that United States, the Trump administration is sending back a lot of illegals. And now we are getting a first contingent of 63 sent back to Haiti. And then among them, they discover 3 have been infected. So we fear a lot, because there are other illegals to be sent back in their country. We fear that could be a factor to spread the virus in the country, in Haiti. So we are trying to solve that issue. We understand this is a right for any country to send back people who are illegal, but at the same time, we would like to avoid that those people come, and bring the virus in Haiti. And after all, that could file back to the United States due to the interaction we have between the two countries and all the countries in the Caribbean. So maybe this is a good thing, maybe to talk with the US to see how we can also have a common policy for their area about the best way we can fight the COVID-19, because like Bill Gates said, we cannot find local solution only for the COVID-19. We have to find a global solution, because you can see only one case coming from China, the devastation that has been made among the world population. So the solution, it is not one country, but this is for the whole country, and better we get together. And especially we in the Caribbean community, we should first start with our own community and try to find a common solution. And so we continue to do that fight, but I'm open if we can continue that conversation, and I'm going to report to my government, and we'll be very happy to collaborate with the foundation and the community of the CARICOM, and to see a global solution for all of us. So I'm going to stay now, and if there is any other question, I'll be very pleased to answer. Thank you.
Great. Thank you very much, Ambassador from Haiti. We really appreciate your insights. And Anita?
Thank you, Ambassador. Up next, we have Ambassador Dr. Philip Brown from St. Kitts and Nevis.
Ambassador Brown, you can unmute.
Are you hearing me?
Yes, Ambassador.
Okay, thank you. Well, I too want to say a special thank you to Authentic Caribbean and your committee. A special good afternoon to my ambassadors. Allow me also to say good afternoon to Nancy Penn, who I've not seen for a very long time. And good afternoon to all those listening to this. And thank you for this opportunity. COVID-19, we have now in the world 2.5 million confirmed cases. And in fact, a study done in Santa Clara, California, and a German study has demonstrated that the actual number of persons suffering from COVID-19 could actually be about 50 to 80 times the confirmed cases. So you see, we could be about 100, upwards of 100 million persons affected. Fortunately, those studies will demonstrate that the majority of persons get a mild illness, and in fact, the death rate is perhaps less than 1%, which is good news. Bad news, though, the swiftness with which COVID-19 has decimated communities, especially minority communities, exposing fault lines of health and economic disparity, reminds me, as I'm reflecting on it, that all human is as grass. Grass withers, flowers fade. And so we are thankful. One of the things we haven't given thanks for is to God, because we are here, because so many of our friends and family and relatives are not here. In fact, I was reflecting on an article today demonstrating how it made reference to it. Some of the zip codes in New York, which have been hardest hit, areas where there are lots of Caribbean people there. And so we have to be mindful of that. But amidst that, there are a lot of green shoots. In fact, when you see all around the world, people going at 7 o'clock in the evening to serenade these health workers, who put their lives on the line despite inadequate PPEs. We are sending people to war without inadequate ammunition, and it's so devastating. And there are other green shoots. We are sharing, we are caring, people looking after neighbors, etc. But in the midst of that, it brings out the best in us and it brings out the worst in us, because we see the systemic racism that has been evident, poor access to health. In some cases, we see racial discrimination, and we see all these things across the globe. And so we hope, and as we talk about in the New World Order, and we hope that after this, the good will supersede, and that we'll have a world order not just of dominance and submission and of racial discrimination, but of justice and equality, cooperation and partnership. That said, in St. Kitts and Nevis, we had our first case on March the 24th. Well, the first 2 cases, case 0 and case 1, a nurse, a nurse and her son. And almost immediately, within 2 days, we had a state of emergency, 7 p.m. to 5 p.m. Like most other countries, we had just the essential services were just the essential, so people working in the essential services sheltered in place. We did relax it on weekends after the second week, relaxed it on weekends. And now we've relaxed it a little bit for 4 days. And some business places we are gradually reopening. We have to date, we have done 257 tests. We have 15 confirmed cases, 11 on St. Kitts, and 4 in Nevis. 30 pending results. 71 people are still, persons are still quarantined at home. Nobody is quarantined in facility. 621 have been released from quarantine. And thankfully, we have no deaths. In fact, we have nobody in hospital. Initially, 2 persons were observed in hospital, I think, overnight in Nevis, but we have nobody hospitalized at this time. The day before, we had a first case, stimulus package was announced, $100 million. That most of it staffing, contact tracing, testing, etc. Like many other Caribbean countries, fortunate to have 34 health persons from Cuba to assist us, and they have once again stepped up to assist, even though they have, I think I see some 14 countries around the world, including Italy, to help. So we have those. We had education. Schools were closed as well, almost immediately, and so online classes. So before we had the first case, there was a survey done, a household survey done to determine whether teachers and students had the capacity for homeschooling. And based on that survey, 2,000 laptops were provided for those households that did not have 1,000 laptops. And it was arranged over 100 households got free internet, so they were able to do online schooling. The agriculture department, they got 14 million. They were supplied free. The farmers had free water, free seedlings, and they were plowing assistance. These are the things we focused on: health, education, agriculture, and of course other funding packages they put into place. Reduction in corporate taxes for companies which retain 75% of the workforce, reduction in unincorporated business taxes, removal of VAT and import duties on certain items, especially things like health stuff, over-the-counter stuff you would buy, vitamins, sanitizers, soap, and that type of thing. We too followed the AHO guidelines and instituted all the WHO recommendations, social distancing, and so forth. We are hoping that we have not had evidence of community spread. It is likely that we may get some, especially as we start to open up a bit, because that is almost inevitable. But we are hoping that we will be able to contain it, and that our system would not be overwhelmed, and that's really the idea. So inevitably, I suspect most of us will get it. It is highly contagious. Most of us will get it in the end until there is herd immunity, which would mean upwards, because it is so contagious, upwards of maybe 70% who have gotten it, or till there's a vaccine. So the idea is just to make sure that the health systems aren't overwhelmed. And I want to support, moving on, I want to support some of the things that Ambassador Lynch read. Oh, sorry, I need to say, although the students or external students weren't a part of the package, we have now had to institute something to assist these students, because for the states, you know, they work to supplement, and once the schools closed down, they were in dire straits. So we have been working. Apart from supporting the items, issues that Ambassador Lynch raised, I want to just mention a few others as we move forward. In 2005, the International Health Relations 2005 was passed at the UN. The idea was that every country should be in a position to prevent, detect, and respond to both natural and man-made disasters, including pandemics. And so we always knew that something like that on the horizon, because every 100 years one. Unfortunately, I don't think we paid it too much attention. And now going forward, we will have to look at that, ensure that we are all in a position, because especially with climate change coming on, there will be new and emerging infections. And if it is not a pandemic, it could well be an epidemic. So that is one other area, Ambassador Lynn, that we need to focus on. The food security, that is spot on, and we have to be prepared to grow more of what we eat, what we consume, to do that more. And fortunately, in the OECS, and maybe Ambassador Gilchrist will talk about it, because St. Vincent is spearheading that aspect of it in food security. Phytochemicals, I think that's for plant medications. I think that's one area in the Caribbean that we really need to develop, especially when you consider that in cases of like pandemics and so, medications can go scarce. And so now that we are talking about, all of us talking about the ginger or garlic or turmeric and so, and we need to focus on these things, moringa, tammy cherry. We need to, I think, some of the industry need to look to improving and building industries, small in phytoceuticals. And then our relationship, strengthening our relationships and trade with each other. And also, I think, with Africa, I think this pandemic is going to present an important, opportunity, a big opportunity for Africa and its diaspora to work together. We have seen it has exposed, as I said, the systemic racial discrimination, the systemic issues facing Black people in terms of here, especially in the US, in terms of the burden of chronic disease, access to good health care. And so I think we need to look at those things, deal with the background causes, and build up our relationship with our motherland. I think that is key, because I think we look and see what's happening between China and Africa and all, and saying, why should everybody be going there and taking the wealth? Why don't we work with them to strengthen our relationship and keep some of those resources of Africa and its diaspora? We look at how immigration works, and everybody is going to be, Canada has slowed immigration, US is doing that, and everybody is now looking more nationalistic. And I think time we look at strengthening other relationships, including relationships with Africa. And I'll stop there for now.
Thank you so much, Ambassador Thelma Philip Brown. Next up, we have Ambassador Anton Edwards from St. Lucia.
Ambassador, welcome.
Thanks. Just a slight correction. Edmonds, not Edwards. I know it happens all the time, but it's okay.
I'm sorry.
That's all right. Look, let me just give a quick snapshot, and the beauty and the curse of coming where I am presenting is that my colleagues have covered most of the major points, especially as it relates to the region working more closely together. But specific to St. Lucia, we had 15 cases of COVID-19. We have 13 people who have recovered. We've had no deaths. We have 27 people in quarantine and about 41 people in isolation. We've done 364 tests in St. Lucia. That's a mix between tests being done locally as well as being done by CARFA. In other words, us having to send them out. Initially in March 31st, we had a 24-hour curfew in place. And since then, we've sort of moved to a little bit of a partial shutdown, where basically we have a curfew from 7 p.m. to 5 a.m. in the morning. Some of the things that has sort of jumped out as a result of this in terms of warts are the following. This has become a real test to our medical system, really because we were in the midst of number one, transitioning to one new hospital, and then we have another facility in the south of the island that is not completed as yet. So the issue for us in St. Lucia was really one of being able to stand up a new facility and at the same time retrofitting another facility as it relates to people with respiratory illnesses. We're very much sort of engaged in telemedicine services and really looking at expanding polyclinics as a result of this. Now, this was always in the government's plan, but this has really forced us to realize that we have to decentralize the provision of medical services throughout St. Lucia. And if there's a positive as a result of this, it's really and truly recognizing that the healthcare system is not as robust as we need it to be, especially going forward. Some of the key elements in terms of government programs really began over the Easter weekend. We've had food programs, food baskets being delivered to the underprivileged. We saw the launch of a national feeding program where we had about 5,000 underprivileged persons. Less than that initially, but ultimately we're looking at 5,000 underprivileged persons who would benefit from that program. The benefit right off the bat was really we had the hospitality industry step in, even though the hotels are closed. So you had the chefs come in, the hotels allow access to their kitchens. And then we had really the ability to tap into our farming community, those who supply product to the industry. We have a framework in place where we want them to continue, obviously, to grow local product. And we actually want them, as a lot of people have indicated, to expand production. But we were very much were fortunate that we had this sort of public-private sector partnership on Easter Sunday, which sort of gave us an idea as to how the private sector can work as partners, how the farming community were able to supply for a local population that is increasingly in need. Unemployment, of course, the economic impact has been significant. We with all of the hotels closed, in essence, most people who are in that industry are unemployed currently. And in as much as our National Health Insurance Corporation will provide subsistence allowances for people who have lost their jobs, that doesn't really, in the long term, that does not sustain an economy or a country. The government has some programs in place in terms of offering tax credits to companies and other entities that would retain their staff. But one of the realities, once again, economically, is that the government can provide all of the incentives that they can, but businesses run on capital and they run on cash and transactions. So because we're closed, like many other countries in the region, Jocelyn mentioned this in the beginning, no revenue coming in means, no revenue coming in. And the tax revenue that you collect from these industries is what you use to service your foreign debt. So we're finding ourselves in a situation where things are going to be very tight in terms of where we are fiscally. It was mentioned early on, Ambassador Colley, I think, mentioned it. Obviously, we're on the brink of a hurricane season, which we should have all been preparing for now in terms of putting resources away. That rainy day fund, which we've already tapped into. So we're in a pretty tough spot, I would say, going forward, as it relates to our access to capital to be able to protect ourselves from impending hurricanes. And of course, the utilization of our shelters. I mean, this is the next thing we have to think about, is heaven forbid, this is going to be an annual issue, despite the arguments that, it's not heat resistance and everything else. As everybody well knows, in the Caribbean, most of our shelters are indeed schools. So at the end of the day, how do we start to plan for an infrastructure which is not prepared for social distancing? How do we now basically look at the fact that the schools that we have in place, where we rush everybody into when a storm is coming, may not nearly be enough, because we're going to have to start to practice social distancing over a longer period of time. A couple of other quick points I want to touch on. One of the elements, and I look at this as an opportunity and a challenge, is for example, even the educational system. The fact that we have to practice social distancing, the fact that we have to now teach our kids online, is also exposing. Ambassador Philip Brown highlighted the fact that the government of St. Kitts has procured laptops in terms of students. But quite frankly, in the case of St. Lucia, we were just about rolling out an ICT program for the whole country. We were just about looking at areas where we realized that the last mile in terms of hardwired access or even Wi-Fi, just really mapping that out. And then all of a sudden we're in a situation where we're forced to use a system that we weren't even ready for. We were just looking at issues of teacher training, of curriculum development, and even getting our own teachers to be much more adept in terms of using technology. Now, as an anecdotal story here, I'm currently in Fairfax County, and my daughter is in high school here, and they're having problems with Blackboard. So for the past 2 weeks, they've been off and on. And today, I think the superintendent basically pointed out that they're no longer going to use Blackboard. So if in Fairfax County, which is supposed to be one of the richest counties, well, definitely in the Washington, D.C. area, if not part of the United States, is having these kinds of problems, you can well imagine what we're going to face, not only in St. Lucia, but in the wider Caribbean. Because the challenge for us has always been to really and truly prepare our kids for the future. Now, the upside is that because we're being forced to do it, because we're being forced to sort of pivot and walk and chew gum, as they say, this is going to be the opportunity, I think, for us to really and truly jump whole hog into it, both feet into it, and in essence, maybe take that quantum leap that we needed to take. And we're being forced to take it, but we're being forced to do it, but that leap that we needed to take, so that our kids and in the future are going to be better prepared for the competitive world that we face. The economic risk is real. Ambassador Lynch outlined elements of that. I think Ambassador Colley did as well. Look, we're all countries that in as much as we're termed to be middle income countries, the reality is that we're one step, an inch away from something happening which sets us back tremendously. And this COVID-19 issue is one that, even though the numbers may be small in our communities, the fact is that the minute we open up, we are going to be exposing ourselves and our people to the virus, and it's something that we're going to have to live with. So the cost to us is hard, because we can't go out there and raise money easily, because we are considered to be middle income countries in many respects. The cost to us is high because a lot of countries in the region are highly indebted. So as a result, the idea of you being a good credit risk, especially when the markets in the United States and globally have tanked, is not very positive. And even in the case of countries, we all roll our debt over on a regular basis. And the fact is that in as much as maybe we had a couple $100 million or whatever the amount is that countries may have on the open market, maybe at 2 or 3%, what's the reality now? If you go to the market to try to roll that money over, chances are somebody's going to ask you for 6%. Nobody's looking to be, or people basically want their cash, because at the end of the day, the investors who buy our bonds are people who are investing in terms of people's retirement plans here in the United States and elsewhere. So there is a harsh reality that we're going to have to face as a region. And there has been an effort already by leadership. Prime Minister Brown of Antigua and Barbuda, who's the chair of the caucus in terms of the caucus of finance ministers and heads as it relates to finance, has already put a shot across the bow to the international financial community as it relates to things that they need to look at pointedly as it relates to countries in the Caribbean and issues of debt relief and others that we have to deal with. Prime Minister Motley, as chair of CARICOM, has also spoken up on that. And for some countries in the region who actually, interestingly enough, and I mean, Barbados, Jamaica, some of us who were just sort of starting to stabilize fiscally. All of a sudden you get sort of this gut punch, you know, you get this sort of hit financially, where now you're realizing that you were servicing your debt, you were doing all of the right things, and then now you basically have to in essence take on some more debt to survive, to allow your country to survive over this period of time. One of the things specific to St. Lucia that we're finding is that I'm now understanding how many people from St. Lucia who are outside of St. Lucia, in terms of, for example, folks on the cruise industry who work with the cruise lines. So now you get caught up as governments in terms of how do you repatriate your nationals who are working on the outside. How do you, for example, us in the case of St. Lucia, how do we make sure that we can get them in from the various places in the United States, far less the wider world? How do you get them back into your country when your border is closed, when you have limited capability in terms of quarantining people for 14 days? So these are some of the struggles that we're all going to face. How do you address the fact that, I think Ambassador Philip Brown mentioned it, that you have students in the United States and elsewhere who basically came up at school, and now they're finding themselves in a situation where they want to go home, number one. Number two, we're getting to the end of the semester. So for those of them who are here and who are being housed and taken care of by a lot of the good colleges throughout the United States, but the fact is that in another month or so, the semester is done. In another month or so, it's time for them to come home. Collectively, I guess all of our jobs has been to reach out to our communities, to our folks who are here, to help them in terms of making sure that they don't run afoul of U.S. regulations. I mean, you know, encouraging people to fill out your paperwork, to extend the time that you're here. Little mundane things that you don't really think about. You all of a sudden recognize that you sort of have to get into the space to provide that coverage and that support for a lot of your nationals in the space. I want to close with a real positive here, is that in the case of what we're finding in the case of St. Lucia is we're finding that our diaspora community, our associations have been very... I'm not sure if, can you hear me or is... Okay, thank you. So one of the things that I want to take an opportunity to commend publicly is really and truly, and I can't speak for all of my colleagues, but in a sense, I'm going to venture out there and say it's the same thing that's happening for all of them, is that our diaspora communities, our associations, of course, entities like yours, the Authentic Caribbean Foundation, Claire, in terms of the work that you do on the policy front, but a lot of our national associations as well are really and truly stepping up into the space as it relates to the outreach from our nationals that are in the community who need some support. For us, with a lot of the students that we have who need some capital, we're finding that our associations are really the ones stepping up into the space to provide them with the support. And I must say, as the representative of the government here, I'm very, very appreciative. So I make a joke though that you know, they may need to help some of the embassies as well, because we're probably out of sight, out of mind in terms of our national governments and debt servicing and everything else. So we're all fortunate to still have our Wi-Fi's on and to be connected with you, and we're very much appreciative of the opportunity.
Thank you, Ambassador Anton Edmonds. Next up, we have Ambassador Lou Anne Galen Gilchrist from St. Vincent and Grenadines.
Go ahead, Ambassador.
Thank you, Mr. Sharp. Good afternoon, everyone. Mr. Andrew Sharp and his team at the Authentic Caribbean Foundation, I extend my gratitude to you for this kind invitation to participate in this virtual town hall meeting. Dr. Claire Nelson and the team of ICS, good afternoon and thank you as well. Colleague ambassadors, embassy staff, guests, it's my pleasure to present to you a very brief overview of the COVID-19 situation in St. Vincent and the Grenadines. And let me begin by saying to you, not that I am an eternal pessimist, but it is a reflection of the reality which now confronts us. A simple thing that I learned in primary school: it never rains, but it pours. And I say this because we are fighting not only the COVID-19 pandemic, but we are, as I'll remind you, still perpetually, I should say, in the hurricane season. Yes, it officially starts in 2 months, but we are always in a state of readiness or reconstruction or planning, building resilience. And all of the discussions we've had so far in the past have focused on building resilience, not only in terms of our buildings, but also in terms of the economy and in our health sector, in our tourism sector. And here we are, poised on the brink of a pandemic, not poised on the brink of a pandemic, but in a pandemic which is crippling our development. So on March 11th, St. Vincent and the Grenadines recorded its first positive case of COVID-19. This was a female professional who had returned from the UK. Realizing that she might have been exposed to the novel coronavirus, she acted responsibly by contacting the health authorities and then remained isolated in her home. Patient 0 has now recovered. All of our cases of COVID-19 were imported in the early days. I have not received an update on that as yet, but I can say that we have had no deaths, luckily. We have now 13 confirmed cases of COVID-19, and 10 of these are active and 3 have recovered. In terms of actions by the government, advisories were given to the public on good hygiene practices, as well as on physical distancing and mass gatherings. Travelers to St. Vincent and the Grenadines with a history of prior travel to certain countries were asked to quarantine themselves voluntarily. Our isolation center, which construction began a few weeks ago, will be opened shortly. The Ministry of Health, Wellness and the Environment is working to minimize the risks which COVID-19 poses to our population. Now, our government presented an economic recovery stimulus plan to mitigate the devastating impact of COVID-19. In Parliament last week, amendments for the protection of employment were made to the relevant acts in order to provide support to employees who have been adversely affected by the new arrangements brought about by the COVID-19. The transportation system in St. Vincent and the Grenadines is private. Therefore, the government presented and had accepted the sum of $700,000 approved in the COVID-19 supplementary estimates as a subsidy for the minivan sector. This is especially important as these operators were asked to observe protocols, which included carrying a reduced number of passengers per trip. And they were also provided with assistance and guidance in maintaining the required level of cleanliness in their vehicles. Now, with regard to food security, it is universally known that St. Vincent and the Grenadines is a land of fertile soil, and we are famous for our agricultural produce. So we are leading in the OECS, at least with regard to food security. And in fact, I just got some photos of our greenhouse farms, and we are doing very well in producing healthy and organic agricultural products. With regard to trade, We hope, Ambassador Lynch, we hope to restart trade in agricultural produce with Barbados as soon as you are so ready. We are therefore calling on our CARICOM member states to ensure that barriers to trade are reduced, if not eliminated, in our region. And with regard to extra-regional trade in agricultural produce and agro-processed goods, we continue our work with the relevant US departments for trade facilitation. And I know, Dr. Nelson, you know that we were working on this with you some time ago. The economic setback in the tourism sector requires our leaders to be creative and our entrepreneurs to be innovative. In fact, we have a rum distillery in St. Vincent and the Grenadines, and they were able to produce hand sanitizers. So they were able to diversify and produce hand sanitizers because, you know, with the advent of the novel coronavirus, such sanitary products became scarce. Now, Rachel Weinstein, pardon me if I do not pronounce your name correctly. You asked about tech companies supplying students with laptops in order for them not to lose education, for us not to lose education and human potential. Well, it is especially important in moments of difficulty that the socioeconomic disparities in our society are neutralized, because then is especially when they become pronounced. This is no less so in the education system. So our students who were in ordinary time at risk become now even more so now that schools have been closed. So what our government is doing is that they're ensuring that at least 680 households are going to be able to access an internet connection for a period of 2 years at the cost of $10 a month. So that is one facility which the government, along with the USF Smart Fund, is going to do for those families who do not have internet connections. And this is so that the students can have a connection to be able to access educational services online. Now, our one laptop per student project of a few years ago was visionary. Now the challenge is to replicate this type of project to train teachers to teach online so as to minimize the disruptions to our education system. Now, this is not as seamless as we might think it is, because a few years ago, under the one laptop per student project, we saw that there were myriad problems. And it's now going to be extremely difficult, even if we were able to procure one laptop or some electronic device for each student and each teacher to teach and to learn. So it is going to be challenging. And as we cannot foresee the end of the restrictions under which we have to exist at this time, we have to be very creative and very tolerant and patient, because we do not want to lose our human potential. Now, given the robust nature of our health system, yes, we do have challenges in terms of procuring the PPE and other medical supplies to address the COVID-19 situation at home. We can be sure that no person in need of medical care in St. Vincent and the Grenadines will be excluded from medical services for any reason whatsoever. And I repeat that because we all see the news and we're all aware of the situations which exist in certain parts of the world. But I can say without fear that in St. Vincent and the Grenadines, we are inclusive in the provision of healthcare services, and no person in need of medical care and attention will be shut out of the system. Now, all of our efforts must be geared towards ensuring that the health crisis is not as severe as the economic fallout with which we are dealing I was saying to someone earlier that it is very difficult for us in the Caribbean to catch a break. I'm thinking of our fellow CARICOM countries who have discovered oil reserves, who recently found reserves of oil, and look at it. Look at the cost of 1 barrel of oil now. So that highlights and emphasizes the point that we cannot, although most of us are islands, we cannot survive if our approach to the COVID-19 is insular. We cannot survive unless we work together as a region and unless our communities, our local communities, our regional communities, and our international partners work along with us. So ladies and gentlemen, that is my overview of the COVID-19 situation in St. Vincent and the Grenadines, the way I see it. And I will repeat that our government is attending to all aspects of our social, economic life, especially in the health and education and agricultural sectors, to be sure that we survive this pandemic and to be sure that we do not lose any lives to the COVID-19. Thank you very much.
Thank you so much, Ambassador Gilchrist. Last but not least, we're going to have Grenada speak.
Ambassador Smith.
Thank you very much. Thank you very much to the organizers of this forum, and I want to greet my colleague ambassadors and everyone on the line. Those of us, we know this is the age of social media, so persons are looking at us on Facebook and Instagram, and I really want to thank you, Dr. Nelson, for adding me to the panel. And if I may, I know the time is late, just to give the statistics on Grenada. We've done upwards of 147 tests so far. We have 14 positive cases, and I say that in quotation, 13 on island, 6 active, 7 recovered. We have 0 deaths. Thank God. Parliament passed a stimulus package for the initial stage of 3 months. The schools are shut down. The essential services only are open. But in addition to that stimulus package, there's an additional $10 million allocated to the Ministry of Health, and that is to procure PPE and other testing equipment. Grenada is in a state of a limited state of emergency. And that means people can go about to do shopping or to get pharmaceutical supplies between the hours of 5 a.m. and 7 p.m. Of course, all the other stringent measures are in place. We've had a visit from PAHO. Of course, I think we got a clean bill of health, and for most of the nations in the hemisphere, I think we have taken the pandemic seriously, and we have instituted a lot of measures. I want to think that perhaps because we're in the same geographic region, and even the OECS countries, I can see the similarities with St. Vincent and the Grenadines and St. Lucia. We have been, I think it's perhaps based on proximity. We've also had 1,500 tablets allocated. They have not gotten to the island as yet, but they were donated for the students who are less fortunate at this point, because right now we're just doing schooling online or social and our corporate partners have been very forthcoming on the island. The Digicel and Flow, they have given free gigabytes to families who do not normally have it. So even on your cell phone, the parents can help the students at home, and we have 1,500 devices coming in very soon to help the less fortunate students. We know that CXC had made some rulings that's throughout the region as well, so some of the examinations would go on. The others that are not essential for the lower forms, that will be held until we can resume business as usual. But I must say that all Caribbean governments have really stood out in this time, and I think it's a beacon out there, because we've seen what's going on around the world, and we can say that they have taken very proactive steps to stem the tide. Of course, we will have a lot of fallout down the road, because of course we depend on tourism to a large extent, and that industry has taken a hit, and it probably will be between 2 and 3 years before we really see it flourish again, because even if we open our borders, people might be hesitant to travel, or people would not have the funds to travel. So I think it's something that we have to look at. And we always talk about diversifying our product in the Caribbean, and perhaps it's a lesson there as well. One of the other things I must say, and I think St. Lucia mentioned it, is that we have called our emergency services into play as well. We call it NADMA. I think every country has an acronym for the emergency services, because we know we're approaching the hurricane season. But as Ambassador Edmund said, when you have to shelter in place, how do you put contingencies in place for social distancing? So now we have to look at that in advance, so we make sure that there are shelters that would be COVID specific in case you have people who need to be isolated. So that we're also on our task force, and we've put a task force together that takes in all the different players and the stakeholders, because we know that we're in this for the long haul. We can't come out of the COVID the way we went in. We really have to be strategic with what's going on. So again, I want to thank everybody on the panel, and I want to thank you for giving me the opportunity to report.
Thank you so much, Mr. Smith. Next, we're going to have Donna give an update on Trinidad and Tobago, since they weren't able to make the call. Donna?
Donna?
Donna, you have to unmute.
You have the information. Donna, are you hearing us? Go ahead, Anita, with the information, or I could read it for you.
You have to pull it up.
Just a few minutes while we update. Donna?
You could just move ahead to the next speaker, Andrew, so we don't lose time. Just go look at that, so she can come back at the end of that.
Perfect. So moving forward, Anita, you could proceed with the program.
Okay. Leslie, you can go ahead.
Great. Thanks to all the ambassadors for sharing your COVID-19 updates. Now we're going to hear from 3 diaspora countries on their medical missions and initiatives. I would first like to call on Dr. Karen Dunkley from the Jamaican Diaspora Northeast. Dr. Dunkley, can you introduce yourself and share some of the work that your mission is working on currently in light of COVID-19?
Thank you so much. Thank you certainly to Andrew Sharp and to Authentic Caribbean for including the Northeast Diaspora, as well as an illustrious frontline doctor that we have the privilege, who is Jamaican, Dr. Trevor Dixon, and he will join us from the Jaja Foundation, Jamaicans Abroad Helping Jamaicans at Home. We really have to say that we have an extraordinary partnership, and we must acknowledge certainly our ambassador in Washington, D.C., Ambassador Audrey Marks, as well as our Consul General here in New York, Consul General C.G. Wilson, who has really implemented a tremendous collaboration with those in the diaspora and who are diaspora leaders to keep us informed and engaged regarding the information around the COVID-19 pandemic as it pertains to the impact here stateside. One of the key areas in which we have a tremendous partnership and the ways in which we have sought to firstly assist our diaspora in need, those who reside here, really have been around the basic needs, the food, the clothing, and the shelter. So we have implemented a system whereby we have state personal contacts in each state, and those who are in need can access the resources online if they enter their zip code on our website in the Northeast at www.janed.org. They're able to access the local programs, the federal programs, or the state programs around food, bill payment assistance, and any other healthcare needs that they may have, whether or not they are documented or not. Importantly, for those who are not online, because a tremendous segment of our population is not online, our state personal contacts have established partnerships with our faith-based organizations as well as our community-based organizations to ensure that we are reaching each other and that we're supporting our community. Another key support that we have implemented from the diaspora perspective has been a tremendous need for counseling services. Times are uncertain, and in the times of social distance, there is a need for connection and just a need sometimes to converse with someone who looks like you and who sounds like you. So we implemented a counseling services hotline, and we have seen a tremendous uptick in the number of individuals who have reached out just for counseling as well as for grief counseling. The Jamaican community, like so much of the Caribbean, have experienced tremendous loss from COVID-19, and we are ensuring that individuals can access counseling for emotional health as well as grief counseling if needed. One of the key pieces of information at this point in time is certainly around the different immigration needs. Many of the ambassadors discuss the lengths and the different programs and the ways in which they have addressed these needs. Just to highlight, Ambassador Audrey Marks and our Consul General Wilson, there is a contact center which we implemented here stateside. So those Jamaicans who, for whatever reason, have immigration needs, if they were on temporary visas, if they need waivers or extensions, they are able to access that hotline and to share that number just in case people are listening. If you are Jamaican, 877-226-6879. They get in touch with the ambassador in Washington or the consul general at the email address or on the websites as well, so they can get assistance as well as the correct information in terms of handling their immigration needs and requirements. I think what is key for us who are certainly Caribbean and we're in the diaspora is that we have to rethink how we're going to support our communities in the wake of COVID. And Dr. Nelson, I know that you have reminded us about this conversation around regeneration. And the reason why I'm emphasizing that is because in the Northeast diaspora, the Northeast think tank, we implemented what we call a public awareness to really say to our community in user-friendly language so that they can understand from people who look like them and speak like them and understand the cultural mores that the social distancing message was critical because we're a community that we like to gather, we're very social, that the sanitizing, the message was really simple and that it was relatable. So we did a lot of public awareness. We targeted the groups generationally. We had a messaging for our younger group. We had a messaging for our elderly, for our faith-based group, and just for the general population. I think that that is significant and cannot be underscored. We also benefited from a lot. We have tremendous, tremendous expertise. Dr. Dixon is a frontline worker. He's here. We convened in the Northeast diaspora, and Andrew Sharp actually is our state personal contact in Massachusetts. So shouting out to you, Andrew, for all the work that you do through Authentic Caribbean and us in the Northeast diaspora. But we convened in Northeast where we're able to collect thinking of medical professionals who are Jamaican, and we're able to get their thinking around resource and strategy. What is it that our community needs to hear? What are the most preventive steps? Where can they access critical resources? And we're really thankful because the Northeast health sector really have provided tremendous support. It's comprised of our nurses, mental health professionals, Lorraine Smith, who runs our counseling hotline as well. Those are the big pieces. For us as diaspora, we are having a conversation now about how do we restore, what does restoration look like, what does rejuvenation post-COVID look like, and what conversations do we now need to have around health? How do we now need to reimagine our education sector so that we can really meet the needs of our education across our 17 continuum? We're thinking about food independence. How does that conversation now change and shift to us diaspora in terms of supporting our country and our Caribbean countries as well. And critically, a critical piece of that is around research and development. Dr. Nelson was so excited, and this became viral. A group of young Jamaicans developed a ventilator. And now we're seeing that we have to become more independent. We really have to revolutionize how we think and how we act, because tourism, as many of the ambassadors discussed. So we have to begin to invest in our own research and development as it pertains to health, as it pertains to other sectors, so that we're not dependent on any other countries. So the diaspora continue to engage. We have communicated, collaborated, and connected. Certainly, again, to our Ambassador Audrey Marks in Washington, our Consul General C.G. Wilson in New York, and working with a group of dedicated individuals and really reaching to the average citizen who don't even understand. Like lots of people, they think diaspora is this big thing. And we're saying, no, you are a diaspora. A diaspora is anyone who lives overseas, anyone who's not living in the native country. So we are reimagining our work and really being accessible to our community so that we can help and assist and empower them during this COVID-19 pandemic.
Thank you, Dr. Dunkley, for your update. I would now like to call on Dr. Trevor Dixon from the Jaja Foundation. Dr. Dixon, can you introduce yourself and share some of the work that's happening on the ground right now?
Yeah, hi, my name is Dr. Trevor Dixon. I'm an emergency physician. I work at Jacobi Medical Center in the Bronx, New York. I've been an emergency physician for close to 15 to 20 years. We've never seen anything like this. Most of us physicians practicing, this is actually a new area for most of us. I will tell you that being in the Bronx, New York, it allows me to see the diversity of the patient population here in the Bronx and in New York City on a whole. And I'm sure many of you here, many of your family members, friends, the citizens of your country are from the Bronx area, if not Brooklyn also. We've lost a lot of people from the English and both non-English speaking Caribbean in the New York area. We've also lost a lot of first responders who are from many of your countries. New York is a unique area, so most of the healthcare workers are from the West Indies, both English and non-speaking West Indies, most of the healthcare workers. So oftentimes we think about patients, we're just thinking of losing patients. We've lost a lot of loved ones from the Caribbean, but also the healthcare workers that are most afflicted with the COVID-19 because they're on the front line are from many of the countries of the Caribbean. Another thing that's important is that early on, Dr. Karen Dunkley, she was very instrumental in bringing together the minds, so to speak. And in the very early on, she was able to get the attention of the ambassador, and we were thrust to the forefront because the Northeast was one of the heaviest hit areas when it came to COVID-19. And Dr. Dunkley had to think of all the different areas that were affected by the COVID-19. In particular, the patriots from the countries who were stranded. The schools closed, the colleges closed, and she was put to task to try and find homes, food, and shelter for most of these displaced citizens because they had nowhere else to go. So she's very modest when she talks about what the diaspora has done, but she has certainly taken the lead with her team, of course, and we were able to provide a lot of shelter, basic food and shelter for many of the citizens living here in the Northeast. Another important aspect, she had a very close relationship with the ambassador in the Northeast, and we were able to organize a telethon not too long ago, about a week ago, right? Time moves so fast now. Was it a week ago, Dr. Dunkley?
Yes, it was just literally a week ago. We're inching on 2 weeks now, correct?
Yes. She was able to organize a telethon where people from the diaspora here in the Northeast, the Jamaican diaspora in particular, were able to raise funds to purchase many of the equipment that the Ministry of Health in Jamaica needed. So having that kind of close relationship is important. This telethon was not just for the Northeast, it was for the entire Jamaican diaspora, which includes UK, Canada, and many other regions which I might not be as familiar with as Karen Dunkley would be. We also, speaking more about my foundation, I have had a foundation for about 10 years now, 10 to 13 years now. We've had a foundation called the Jamaicans Abroad Helping Jamaicans at Home. It's called the Jaja Foundation. And our foundation was unique because I was able to form a bond with a physician of like kind, like myself. I'm an emergency medicine physician, and I was able to form a bond with an emergency physician in Jamaica's largest public hospital, the Kingston Public Hospital, KPH. And through that bond, we were able to understand firsthand what his needs would be. During COVID-19, we had conversations very early, even before Jamaica's numbers had reached in the 20s. He and I, Dr. Hugh Wong at the Kingston Public Hospital, we were having conversation, and him being the head of the emergency room at KPH, I think was key for us in the Northeast. I can always, bring information to Dr. Dunkley of what the needs are on the ground. Thankfully, early on, there wasn't much need, and Jamaica seems to be having that high slope right now as we speak, where the number of cases each day is more than doubling each day. So Jamaica is at the point now where it's approaching the climax of the COVID-19, it seems like. Is that correct, Dr. Dunkley?
Yes, that is correct. We currently have 196 cases, and we have really seen tremendous numbers, and increase in as much as 23 new cases in the last 2 or 3 days.
Right. So Dr. Wong has always been in conversation with me. And despite the fact, right now it's more emotional and professional support that we offer Jamaica as a country. And that being so because, President Trump has blocked a lot of supplies going into the Caribbean, if you haven't heard already. So anything that's going into the Caribbean, even from China or other countries, he is blocking them and diverting them into the United States. So even as far as COVID-19 testing, if your country don't have COVID-19 testing already, it may be challenging sometimes to get the testing that you need so you can mobilize the resources in your country. So that's another challenge that the Jamaican Ministry of Health is dealing with. And if there's any way we can help, we are here. But my main purpose is to not only provide a source of support for the emergency departments in Jamaica. Anything they need, we can try and help them provide it. But we're also here to teach them how they can adjust their emergency department spaces and how we did it here in the United States to accommodate the influx of patients that you will receive, and how to triage and how to manage the ventilators. Before people think these ventilators are some special equipment. But as an emergency physician, over the past 10 years, I've stressed to the Ministry of Health in Jamaica how important many of these equipments are. And I guess it's a coincidence, that about 4 months or 5 months ago, right before the COVID pandemic, I had donated about 14 ventilators to Jamaica, just because I thought it was something important for them to have on the island. So they're probably using them right now, and they would not have thought they would need these ventilators at this very crucial time. So I think as our way forward, I think obviously everyone is saying, hindsight is 2020. But as emergency physicians, we know that when it comes to budgets and countries and their budgets, healthcare funding is usually not one of while it is supported, it's not one of the most highly supported areas when it comes to budget. And we understand there's a lot of challenges where that's concerned. So, going forward, hopefully we could rethink and try to invest a little bit more into healthcare so that when these pandemic happen, because it's always the same equipment, there's nothing exotic. It's always ventilators and personal protective equipment. So if we can actually put a stress on having more of those as we go forward, because we would like to think that we won't see another pandemic for another 50, 100 years. But the reality of how the world is changing, we know that in the next 5 or 10 years, we may have to face another virus. So we want to be prepared, and not saying that, this is 1 in a million chance.
Thank you. Dr. Dixon, I just wanted to, Herb, thank you for reminding us we actually are at 223, which is indeed correct. Those are the latest numbers. So Dr. Dixon, to your point, we are indeed spiking.
Yeah, we are spiking.
19 and 27 recovered. Thanks, Herb.
Yeah, so the advantage that Jamaica has is us here in the diaspora, here in New York. It's not like before when you had to send a telegram, to let somebody know what's going on. I guess you know how old I am because I was around when Jamaica had telegram. So now we have Zoom and other mechanisms so we can communicate. There's no reason why Italy was very important for us in New York because as emergency physicians, the Italians kind of communicated with us and told us what they were seeing. So we were able to prepare in the sense of using other techniques in conjunction with the ventilators to try and have a better success of saving lives. It was through that sharing of knowledge that we were able to decrease some of the numbers that we had here in New York. We lost a lot of patients, but if we had not had the collaborative efforts of those in Italy, we would have probably had lost more patients. So we hope that, we will be working closely with Jamaica. I know I'll be working closely with Dr. Hewing at the Kingston Public Hospital, because he will see the majority of the patients that come through in this pandemic. I suspect between the University of the West Indies, Kingston Public Hospital, and Spanish Town Hospital, and Cornwall Regional, those are the hospitals who will get most of the volume. So we're here to help, and Dr. Wong knows that, and it's through that established relationship that was built for many years that we were able to have a smooth transition into sharing information.
Thank you very much, Doctor. Thank you very, very much. And I'll leave it over to Leslie as we continue due to timing.
Thank you, Dr. Dixon, for your update. I would like to introduce our last speaker, Dr. Annette Campbell-Fontaine from the Dominican Health and Education Initiative. Dr. Campbell-Fontaine, can you introduce yourself and share some insight into the initiatives that you are currently working on?
Hello, good evening, and thank you to Authentic Caribbean for organizing this town hall. Thank you to all of the ambassadors and the other medical professionals for sharing. The HI, which is Dominica Health and Education Initiative, is a nonprofit organization that is incorporated in Boston and started in 2014 and involves professionals from across the Caribbean that are living here in the United States. And our goal is mainly to assist in elevating health and education standards on the island of Dominica and the Caribbean through enhancing technology and training in education and in medicine. And in order to achieve that, we have over the years donated computers to elementary schools on the island of Dominica. And in the last few years, have been working very closely with the oncology department in Dominica. I am a medical hematologist, oncologist myself, and I'm based in Albuquerque, New Mexico. We have been having monthly virtual meetings with the oncologist on Dominica, identifying the areas of need and assisting in those areas. Recently, we trained several of their nurses in the oncology department with the goal of they having oncology certification. I tell people that cancer doesn't wait for COVID, and therefore we are continuing our efforts in raising funds to purchase a mobile mammography unit for the island. And this is essentially a breast screening clinic on wheels that will be able to go around the island doing screening mammograms and ultrasounds for women at the health centers with the hope of diagnosing breast cancer at an earlier stage where it is curable. In addition, our founder, Dr. Anne-Marie Laronde Richards, works in the pharmaceutical industry, and she has assisted us greatly in working with pharma here in the US to provide affordable, much needed oncology drugs to Dominican patients. So as far as COVID, in my work as an oncologist, I am exposed every day to patients that are at high risk for COVID. And I encourage them and all of us who are listening to really follow the government guidelines in terms of social distancing, wearing masks when outdoors, and good hand washing in order to prevent the spread of COVID. And I know that much of the news that we listen to is the negative news. We hear of the number of deaths and not enough about the number of people that are recovering. And I would like to emphasize that, you know, people with underlying chronic conditions such as cancer, diabetes, hypertension are of course at higher risk. And the things that can be done to decrease the risk is really, you know, managing your diet, making sure you're eating healthy, you know, ensuring that you're taking your medications. I know this may be a time people are rationing their medications because of cost, but if you can, by all means, take your medications as prescribed, getting some exercise, whether it be simply walking around the house, in your yard, in your neighborhood, and certainly getting enough rest. You know, sleep is important. By doing those things, you know, one would be in a better health condition that if you do get infected, you would most likely be in the group that will recover. As a Dominican, I would like to give some updates on the situation in Dominica, since we were not able to have any of our officials there. And these numbers I got from the Ministry of Health and from DominicanNewsOnline.com. So in Dominica, 375 persons have been tested with 359 negative. They had 16 positive cases. You know, 8 of these cases have completely recovered. There are 8 active cases in recovery. 152 contacts were identified, with 151 of them cleared, and 1 contact still under investigation. There are 13 persons that are in quarantine, and over the last few days, there have been no new cases. It is great to report that there have been no deaths in Dominica and no one have been on a ventilator. Our organization, the HIGH, recognized that, you know, all of us are facing tremendous challenges economically and otherwise related to this COVID crisis. And therefore, we are going to follow this town hall in the next week or 2 with a virtual webinar focusing on coping strategies. So we're hoping to have one of our colleagues who is a pulmonologist, critical care physician. She's on the front line giving us some information. We will have a financial advisor and a psychologist, you know, certified in wellness, giving us tips on how to decrease anxiety, depression, and to cope during these uncertain times. So please look at our website, thehei.org, for details on that upcoming webinar. And as far as reliable medical updates, I would like to recommend that you look at the YouTube videos from the American Medical Association, or AMA. Thank you.
Thank you very much, Dr. Fontaine, Campbell Fontaine, for such information. We're so glad that we here in the diaspora is taking charge to see how we can, you know, assist our region and also even to assist our own Caribbean community here in the United States. I now pass it on to Anita.
Thank you, Dr. Dunkley, Dr. Dixon, and Dr. Campbell Fontaine for your updates and providing a medical perspective. Now we will begin our Q&A portion of our program. But before we get into that, Donna has the update for Trinidad and Tobago.
I have a report from Antigua and Barbuda. I will read my report. So Ronald Sanders was unable to be with us. He had a conflict in his schedule, but he asked that we read the report that he submitted. Antigua and Barbuda currently has 23 confirmed cases of COVID-19 on Antigua and none on Barbuda. There are 13 active cases. 95 persons have been tested. Of those, 72 are negative. 3 results are pending. 7 persons recovered and 3 persons died. Currently, 47 are in self-quarantine and 8 are in official government quarantine. Antigua is presently in a shutdown, except for some businesses such as supermarkets, banks, pharmacies, hardware stores, bakeries, public utility offices, which are open from 7 a.m. to noon. A curfew exists from noon until 6 a.m. until Thursday, 23rd of April, 2020. But a decision may be taken on the 21st to continue the curfew until the end of April. The border of the country remains closed to airplanes, ships, except cargo. Our medical facilities, the government is in the process of completing a specific infection disease center from the exclusive treatment of COVID-19 patients. The government has bought or received 6,500 test kits, and extensive testing on the population has started. Before this week, the government had to send all samples to Trinidad for testing by the Caribbean Public Health Agency, but has now purchased its own testing equipment and specialized training personnel to use it. The government has also purchased ventilators. Through government purchases and private donations, there is a relatively large stock of masks in Antigua, and they are currently being distributed for free to the population. Many have been ordered and will continue to be ordered as needed. The Cuban government has made 31 medical persons available to Antigua and Barbuda. They have completed a 14-day period of quarantine and have joined the Antigua and Barbuda medical personnel on the front line for the testing of the COVID-19 and treating patients. There's a shortage of personal protective equipment for doctors and nurses. They have been ordered and waiting for them to be arrived. On the economic points, because Antigua and Barbuda main industry is tourism, more than 5 years of economic growth and progress have been lost since the end of January. Unemployment has been rising in the private sector, such as the hotels and other tourism-related businesses. The government's revenue has declined by over 80%, and the economy, which was due to grow about 6%, is now in decline more than 6%. Nonetheless, the government has not laid off any public servants. End of the report from Antigua and Barbuda.
Thank you, Donna. Now we will begin our Q&A portion of the program. The first question is, what initiatives have your government set in place to protect community members, elderly, disabled, and ill persons during this pandemic? Which of the ambassadors would like to answer that one?
I open the floor to Ambassador Lynch.
Good afternoon. Can you hear me?
Yes, I'm hearing you, Ambassador.
The question is, what have we done to protect community elderly?
So much feedback.
I'm muting all. I'm muting all. Go ahead, Ambassador Lynch. Go ahead, Ambassador.
What have we done to protect the elderly communities? I think that was the basis of the question. I'd like to think that every one of the ambassadors that has spoken thus far has echoed similar sentiments as it relates to how do you really lock down, first of all, your communities overall. How do you deal with issues of curfew, observing curfew, keep the virus from spreading? In addition to that, I think what also the jurisdictions
Somebody, sorry, Ambassador, there's someone, please mute. Go ahead, Ambassador, sorry.
Yeah, but I think overall, I can't say specifically that there has been any particular effort aimed at protecting in one sphere communities themselves, or isolating communities, or folks in the community to be able to help them. I think the overall basis for how the governments have gone about seeking to keep people safe, the issues of border control, the issues of contact tracing, for example, the issues of isolating and quarantining whenever there is any incident of someone testing positive, and then the issue of treatment are really the tools that have been used to protect the entire populations from an issue like this. In Barbados's case, there has been one a field hospital and then another facility that has been set up, which was a former army base or older army base that's been set up to particularly isolate and quarantine folks so that they don't get into the community. And then the issues of shelter in place and lockdown and very specific curfews, I think protects the entire nation and protects the entire population. I can't say in Barbados that anything has been done specifically to isolate. One of the other things, though, is important that where there are, particularly the elderly, I think Barbados has also reached out in terms of providing meals, and some, not only government, but some individual private sector entities have also reached out, knowing that there need to be food banks and be able to distribute food to people who we know are vulnerable and who are locked in. But I can't say specifically that there's any specific item that has been used or action that has been used to protect an individual community or the elderly. Thank you.
I'm sorry.
Thank you, Ambassador Lynch. Go ahead, Anita.
Okay.
We have a comment from Ambassador Coley. Go ahead, Ambassador.
I say Ambassador from Aruba tried to get your attention, so I will yield to her and come afterwards.
Go ahead, Minister.
Thank you, Sydney. In brief, we did 5 to 6 things in Aruba. We stopped any visitations to all the elderly homes and the hospitals. So they are not having any visitors to protect the elderly homes. As for the spiritual and mental part of it, we incorporated 6 lines where they can call and talk to people and have conversations. They also receive tablets that from the government of Aruba that they can see their families, learning how to work with Zoom. We have special hours for them to go to the supermarkets. They go from 7 in the morning till 8. They're the only ones allowed to enter a supermarket, and we're also providing meals.
Oh, very good.
Thank you. Ambassador Coley, did you have anything else to say?
Yes, thank you, Andrew. As you are aware, Bahamas is an archipelago with many islands, at least 30 of them are inhabited with Bahamians and residents. And except for the islands of New Providence, where Nassau, the capital, is located, in Grand Bahama, where the great urban centers are, the family islands are generally very family-oriented, community-oriented, and generally those islands take care of themselves. The good thing is for our family islands, we have no cases of positivity except for a smaller island of Bimini with 1 case. In New Providence, the urban center and Grand Bahama, the government's lockdown protocol and the curfew, as well as the closed border and the constitutional emergency, state of emergency, has essentially kept everyone in their home, except for the times of the day when they are permitted to go out to get essentials, food and water, medical supplies, pharmaceutical supplies, and take care of banking and utility services. As far as the elderly and the underprivileged are concerned, we send a shout out to the Bahamas Food Network, which is a pretty large private sector organization, which has been doing a wonderful job prior to COVID and have stepped it up a bit and are looking after the underprivileged, the poor, the elderly with provisions of food. The Bahamas government itself is not in that business, but between the churches, many of them, and the Bahamas Food Network, and many other smaller feeding networks as well. But the Food Network has been doing a wonderful job. Thank you.
Thank you, Ambassador Coley. I'm going to move to the second question. Number 2, what preparations and plans are in place for quarantine returning citizens? I'll ask that to Ambassador Coley as well.
Oh, yes, thank you. The Bahamas has 7, am I on?
Yes, Ambassador.
I'm sorry. The Bahamas has 7 full-time consulates, and one in Texas, Miami, Atlanta, New York, Washington. We have an honorary consul in Chicago and one in California. And those consulates, I must say, they have been doing a wonderful job of meeting the needs of our students, our Bahamian nationals who are caught in transit, and Bahamian residents and descendants throughout the United States. They have been doing a wonderful job of looking after providing temporary sustenance financing for those who run out of money, assisting with those who are running out of accommodations all across the country. And the big one is our students. They have all done a wonderful job of making arrangements for students either on their college campuses or with family members, friends, and well-wishers. Thank you.
Thank you so much. Is anyone else would like to answer what preparations they have?
I think I'll answer it as for the tourists, because I think what they were asking is if we are prepared to open our borders for tourism. And that would be a question to be asked to all the Caribbean islands. I don't think we are ready. I think health goes first. So I think we have to wait to be sure that we're ready to open and it's safe for the island. The moment that all the islands decide to open their borders, I think we'll have to do many testings. Aruba, that was one of the questions on the chat. They asked us, how are we doing testing? We are the 6th country in the world per percentage doing the most tests. We have 1,450 tests done. It's a PCR test. And we are preparing to do more tests at the airport if needed when we do open our borders. We're also talking to the tourism sector that the new normal must be no crowdiness, tables far away from each other, keeping the 2-meter distance. So I think all islands, we will have to open our borders eventually, but we will have to keep in mind the social distancing and testing to prevent it coming back in the island, or at least being able to handle it.
Thank you very much, Minister Cross. You could move on to the other question.
May I respond to the question?
Oh, sorry, Dr. Nelson or Ambassador Phillips? I'm sorry, Ambassador Philip Brown, go ahead. My apology.
May I? Sorry.
Go ahead. Or Ambassador Lynch, you could go ahead.
Okay. The tourism question is one that's very dear to my heart. It has been estimated that the economic aftermath of this COVID-19 pandemic will last at least 1 year in the first instance, and that's a conservative estimate. I think one of the most important variables for tourism and hospitality-led economy is to consider how they will react to and how they will create a sustainable posture for new travel protocols. I envision the probability, for example, of new seating configurations of aircraft, a possibility of a reduction in passenger traffic, new border controls, and all that coupled with the already challenging rules and regulations that emerged after 9/11 in the US and all over. We have an opportunity at the Caribbean. We seem only to do things when there's a crisis, and you should never waste a good crisis. I think starting now, the Caribbean has always responded very well collectively whenever there are issues. And I think the two Caribbean-led organizations, the Caribbean Hotel and Tourism Association and the Caribbean Tourism Organization, I think there's a need to start now with an intense but different tourism marketing campaign that must be incorporated into the existing advertising and promotion strategy that most of the Caribbean has. Our tourism product in the Caribbean, except for what everyone else does, this rising tide will raise all board. I think we need to be promoted as open for business as soon as there's some return to normalcy, and that we're coming back better than ever. Concomitantly, the tourism marketing must include an upgraded message that says that we are a safe and secure destination or destinations, and therefore that we will protect your families and that we will protect you when you visit the Caribbean. And I think that I've seen this done after 9/11. I've seen this done too whenever there was after the serious crises that we've had. But clearly, again, as it relates to the virus, we need also to get out the information that until a vaccine is developed, and this is before the vaccine comes, our tourism marketing messages subliminally emphasizes the safety of the destination, points of border control, identification of any infections, whether individuals or clusters, that we have everything in place that we will protect you when you come. And I think if that can be incorporated in a very polite manner, not a very vulgar way, I think you will see the overall difference in what will happen when we do open for business. Thank you.
Thank you, Ambassador Lynch. Ambassador Thelma Philip Brown, go ahead.
Okay, thank you. Actually, I wanted to weigh in on the original question, so I touch briefly on both. We too have put into place, we stopped visitors from the homes that we have. We have very few homes, one government run and two private run homes for the elderly and disabled. So we stopped visitors as well. And we also organized for the elderly pharmacies and supermarkets and so for the first 2 hours. So we did that as well. But one of the important things, we are, as a people, we tend to have multi-generational homes. So most of our homes, the elderly are usually at home. So part of the messaging to the young people is that you might be okay, but it's the elderly at home who are at risk. So by targeting those strongly, keeping the children, because most of the school children, even if they get sick, won't be affected. But targeting them and getting them to do what they need to do in a way is protecting the elderly and the disabled at home who are more vulnerable. In terms of visitors coming back and tourists, at this point, as you open, you're going to have a lot of room. We do the strict quarantine. That's why we have so many persons who are under quarantine. Unfortunately, or unfortunately, with all these hotels closed down, we do have ample space for quarantine. I do agree with Ambassador Lynch, but I think too that the COVID, the virus, going to determine the timeline, how we open back. And also our response, how we handle the disease in the Caribbean. Because if we handle it properly, that's one of the things we could say, that you are safer. You come to our region, especially in the cold months, then you come down because we see how devastating it's been in some of the, especially the countries, the northern, the colder countries. So if we handle it very well, we can use that as a marketing tool. Say, well, we don't feel safe because until we get the vaccine, a lot of people may not say it. They can look to, there's some of us are already saying that unless there's a vaccine, it may not be till 18 months or so. In the next winter, we'll have another outbreak. So if we handle it well, that might be a marketing strategy for us to say, well, you can come down because we have a good plan in place.
Yeah, Ambassador Foley, you could go ahead.
Yes, thank you. Very briefly, I'd like to thank Ambassador Lynch, who served as chief of the Caribbean Tourism Association for many years, as well as the Minister of Tourism in Barbados. And he brought quite a lot of knowledge to the tourism product, which is really the bread and butter of virtually every island in the Caribbean. And his call for a coordinated effort in market and promotion for the tourism product is well received. What is all of that is going to depend on a couple of things. Can the United States airline industry get up and running quickly once the all clear is given? Because the airlift to the region is going to be very important, as well as the cruise industry for two reasons. The cruise industry is the single largest industry bringing American tourists to the region, but it also provides employment opportunities for a number of our nationals. And finally, I note that President Trump just recently indicated that he intends to sign an executive order temporarily suspending immigration into the United States. Now, I don't know how that order will affect American tourists coming from the United States into the region. But a number of things have to happen. The airline industry have to be up and running. The cruise ship industry have to be up and running. And I understand that they may all need bailout. And then all of the national borders in our various countries have to be open for business, like Ambassador Lynch says, and ready to welcome. Also, the physical plants, the hotels and lodges and marinas and all of those things have to be coordinated in a position because it is my view that in every disaster there's an opportunity. And I believe that once the all clear is given, the Caribbean region should be ready for an avant-garde of influx of tourism. We should be ready to take advantage of it. That's my point.
Thank you very much, Ambassador. We have a question from the Town Council, Natasha Clergy. She's from Randolph, Town Council of Randolph. Natasha.
Okay. Hi, thank you, Andrew. Thank you so much for putting such a wonderful town hall, and it's a pleasure seeing my ambassador. Salut, Monsieur Hervé Denis. Ça fait longtemps hein, qu'on ne s'est pas vu. Anyways, my question, I don't know if you heard me, but my question would be for all of you guys, because I'm a Caribbean myself from Haiti. I'm from the Caribbean, and I would like to know what is the plan to reach out the people on remote location, knowing that I'm speaking for myself because I don't know if it's the same everywhere, knowing that we have shortage of electricity all the time. A lot of people don't have access to electronics. They don't have access to internet. What is the plan to reach everybody and let them know something like that going on? And also, I have to say, I'm very glad to hear that mostly the Caribbean are at lower infected people and barely no death. That's a good real. We are very limited in resources compared to those big countries. And before I leave, also, I want everybody on this panel to know that if you know anybody in Randolph and surrounding area of Randolph, every Thursday we do fresh fruits and produce giveaway. No, we don't check IDs, we don't check addresses. You don't have to be low income. Everybody's welcome. And if you know any elderly especially the ones living by themselves. We reach out to them every day, any day, not just Thursday. We bring them, especially the culturally eating habits people. We make sure that they have rice, you know, beans and stuff like that, things they usually eat. Thank you.
Thank you, Councillor Natasha Clergy.
Are you ready for the next question?
Who's gonna answer?
Anyone who want to respond to Natasha Clergy question, and then we're going to move on to Dr. Claire Nelson.
Grenada.
You could go ahead, Grenada, the ambassador.
Thank you. I just want to reiterate here because it is something that came out in one of the briefings we've had in Grenada last week. But over the past few years, the government of Grenada put out a call for the less fortunate, those who do not have the means by which to get their houses wired. They would be provided with the material to have the house wired, get the electricity, and they may qualify for the seed program, so that would be paid for as well. This was reiterated in recent times, especially as it related to households with students in it. And that's why the service providers as well gave free internet to those houses. So those who have not taken the government call as yet, they have the opportunity to do so now. So this crisis presented an opportunity for people now to get off their laurels and get that done, because the material is free, as well as the installation, the hookup, and they would be getting rebates to pay the electricity bill as well, to make sure that nobody is left behind and no one is marginalized in times like these and going forward as well. So I know that was a very big one, and it came back to the fore again. So I'm sure other countries are dealing with that as well, but it's something that the government took on board.
Thank you very much, Ambassador Smith from Grenada. Dr. Nelson, any question from you to the ambassadors?
No, if we were to wrap up, I'm ready.
Yep.
Okay. I just, first of all, I just want to say thank you everybody for being on this call. I want to thank especially ambassadors. Before, I just want to mention one thing as a preamble before I go forward. In 2007, right after Caribbean American Heritage Month was passed, one of the things we focused on was ensuring that people didn't take the month as just like a social, let's have more party kind of thing, but we started thinking about how would we organize to affect policy, and a workshop we did then was called Caribbean 2020, the role of the Caribbean diaspora. And I reflect on that day, the 40 of us who sat around that Saturday, and the idea came about having a Caribbean American Leadership Alliance project that would be led by ICS to find ways to work with our fault lines of difference in culture and language and personality, and the fact that we couldn't get along, to find a way to work together. And the Caribbean American Heritage Month movement has in a very big way contributed to where we are today, able to have conversations across all these lines. And really have to say, first of all, thank you to those of you in the Caribbean American Heritage Movement, such as Andrew, who without that would not have been organized in such a way that we could arrive where we are today. And as I sat listening to this, I had moments when I was weeping. I was going through a plethora of emotions, because I feel as if to say the last 15 years, if you will, of pulling off Caribbean American Heritage Month was preparing us for a time like this. We really are at an inflection point or deflection point in human history. And those of us in the Global Futures movement, and as someone who is very visible in that movement, and knowing that Africa, the Caribbean, the Pacific is not talked about, therefore I'm kind of making space for us at that global table, we're very concerned and assured that we in the Caribbean, in my story I've been telling, we in the Caribbean lead the way to the creation of the 2030 agenda that was spoken about as part of Sustainable Development Goals. And it might sound impossible, but like Ambassador said, with every crisis is an opportunity. And if we hear the people and I'm watching the things, I think we have something to go forward on. So next steps. In 5 weeks, we have Caribbean American Heritage Month. We're not gonna have any carnivals, right? Or festivals. So we're gonna be having a festival of ideas, right? Almost every day or every week, there'll be some series of events around issues and conversations that have to do with the regeneration of the smart Caribbean future we've been talking about in terms of the conferences that we've been having. We're going to be looking at both on the domestic agenda here in America. How do we ensure that we're strengthened, we're back at work, our small businesses are back in play, so we can continue to do the work we have been doing in the region? And how do we walk and chew gum and do them at the same time with the work we have to do to support the regeneration of what's happening in the region? So we're talking about, as the ambassador says, there is the healthcare challenges. We're going to tag our things to SDG 3. We're not going to depart from the original vision. We're just going to be moving differently. And the smart agenda, we'll be looking at it from a point of view of the sustainable systems, meaningful metrics. Now is the time for the Caribbean to not just listen to what the World Bank and IMF and IDB is saying, oh, you're going to have to tighten your belt, or you're going to have to do. We have to use this opportunity to reevaluate the metrics around which some of these institutions have been measuring us, because we don't want to be taking out 10% loans to do what? To pay back what? So we as the diaspora have to also partner with other movements, the Jubilee Movement for Africa, to ensure that we give room for this pivot that has to take place. We cannot go back to business as usual. As agility and adaptability have to be the hallmarks of our relationship in this new collective in terms of how will the diaspora be included in the conversation officially with the Caribbean governments. Can we ensure that at the CARICOM heads of government, in the civil society forum, there is room for the Caribbean diaspora to have an official and welcome place as we organize and work with people at the Caribbean Development Bank and the CARICOM to put together the talent bank and the data bank for the different pieces of things that have to be constructed going forward. We're talking about revitalizing the blue economy, of which tourism is a part, but we have to also talk about how do we do fisheries and cruise shipping differently so we benefit more from all of those things. We're talking about the green economy, which is the agribusiness. We have been doing a Farm the Future conference for 6 years with very limited support. But now, all of the ambassadors who have been coming and speaking at our events know that we have the seeds of hope that have been there floating around for the last 6 years. Now we have the opportunity, I think, to use COVID, the disaster of COVID, to be the fertile ground on which we give birth to these new possibilities. We have the creative economy that the IDB has been preaching about. Now we have the time to have for these apps and these competitions that the young people have been doing. And we've already begun speaking to young people to have an event between June 5th and June 8th that will be a big, let's call it idea festival around everything from food security to job security, new jobs in the digital economy. And we want to make sure that the ambassadors and the diplomatic corps is with us side by side. So when these young people come with the ideas and we present them to the Caribbean Development Bank or the CARICOM heads, they don't fall on deaf ears because they are quote unquote outlandish ideas, but actually are seen to be viable, scalable, replicable ideas that deserve funding from the CDB, from the IDB, from the World Bank, side by side with the traditional status quo solutions that will be put forward. We cannot go back to business as usual. So I'm really asking again for the ambassadors to continue to be with us, walk with us as ICS and the Caribbean American Leadership Alliance of Caribbean leaders such as Andrew and others who have come together to say, hey, we're going to do this walk together. And we are going to be calling in you to be partners in the events in June. And partners is ensuring, especially because Prime Minister Mia Mottley is the chair of the CARICOM heads of government, partners is ensuring that in the meeting in July, when the handover happens, that there's room for the Caribbean diaspora at the table. In closing, I've been posting on the chat a space where we have a place for you to post your pictures, your visions, your ideas, your creative thoughts, so we can begin to collate what we're thinking. But more importantly, we're asking you, if you want to be a part of the working group that will not only talk about the Caribbean future from our perspective, but also be creating the diaspora white paper, which we will be presenting to State Department as part of the separate but equal diaspora consultation with state around HR 4939, Public Law 114291, which we've already begun talking to state about. They want us to respond to what we think they have done or not done in the last 3 years. And they want us also to present a new white paper going forward for the next 3 years as required by the law. And we want to continue the way we began back in 2017 by having this be a collaborative process. I will not have the energy to write everything by myself, because I'm also working with people in the Pacific and Africa to pull together our global conversation. Let me add that the Caribbean is at a very important flux point, because Belize is the chair of the Alliance of Small Island States. Guyana is the chair of the G77, and St. Vincent and the Grenadines sits for the next 2 years on the UN Security Council. And we have a Caribbean person who's running the Commonwealth Secretariat in London. I dare say, if we were to organize differently and the governments really walk hand in hand with the diaspora, not just in the United States, but in Canada, the UK, and Europe, we are going to be able to do what perhaps we could not have done were it not for the current crisis in which we find ourselves. So in between my weeping, I say to God, God, open our eyes and our ears and our hearts to work together in spite of our challenges, knowing that we come from the belly of the same beast, and that we're here in this new American space, not trying to create a Marshall Plan, because we're not going to be just borrowing from other people's vision. No, we're going to use the ancestral knowledge that we have, taking wisdom from everywhere in our community, in our transnational Caribbean community, to really dream, reimagine our restoration, recovery, and regeneration of the global economy, where we as Caribbean people can have a space, our rightful place, if you will, in this, as you began, Andrew, as islands in the sun. And I really want to thank Andrew again for bringing his team together to push this out, and thank ambassadors again. We thank you so much for being a part of this and walking with us, and you'll be hearing from us again. Let's work forward to get this thing done for June, so the ambassadors, Ambassador Lynch, who will be handing over to, I think, to Ambassador from St. Vincent, I think they are next in line for the heads of government, whoever she's handing over to, will be able to present our paper to the heads of government, and we have the confidence that our minds and the value of the intellectual and relationship capital, that there's so much wealth in our community that we can leverage that to create inclusive prosperity for us here at home and abroad. Thank you again. Thank you, Andrew. Thank you.
Thank you very much, Dr. Nelson, and I want to say thanks to all the ambassador. And I just want to highlight my team, because without a team, we would have never gotten to all the work that we've been doing. And my team is from the Caribbean. So I just want to say, Donna.
Just say one thing.
I'm gonna introduce Donna.
Yeah.
Donna, you could go ahead. We have Donna.
Can I say something before you wrap up? Sorry.
Yeah, go ahead. Go ahead, Ambassador Lynch. I'm sorry.
Just very, very quickly. The issue, I thank Dr. Nelson for her contribution as well. But I just wanted to say one thing. I think that all of us know that for a long time, a lot of our small developing countries have been graduated from access to concessional financing at the international financial institutions. I think because we have been categorized as, as not developing, but that we have been characterized as countries, middle income countries, we've been graduated from a lot of the access that we need to. Clearly, a number of the jurisdictions, a number of the countries are going to be writing to these IFIs to ask for exceptional access during this period. But I do believe that whatever we do, I think the diaspora and organizations like Authentic Caribbean also need to be involved in that fight. I think if you can partner with us because all the things that we are talking about are still going to be, it's going to be necessary to have a good fiscal base to be able to do so. That fiscal base is being destroyed by the fact that most of our economies are closed during this period. And it means that the correspondence that gets to these IFIs is important to the international financial community, that the diaspora organizations also participate. Letter from you, the note verbal that comes from us, all these things are going to be critically important if we are to get the stimulus that we need to be able to power our economies all over again. And I just want to ensure you that once we are doing our part, that you can also assist us in what you do. Thank you very much.
Thank you, Ambassador Lynch. As I said, I want to thank the team, Donna, Dominique, Leslie, Anita, Jasmine, for being a part of the Authentic Caribbean Foundation at the back end, just doing the work. And we're so pleased that they have stepped forward in providing assistance as Caribbean American in the state of Massachusetts. And we at the Authentic Caribbean Foundation will continue to form bridges, engage with our local and city and state representatives, push for policies pertaining to Caribbean American community and regional policies that will affect us, and to continue to work together with other partners, diaspora partners, Philadelphia, New York, Miami, and work along with Institute of Caribbean Studies to ensure that we have a sustainable Caribbean and also build a strong Caribbean American community in the United States. I want to thank everyone. I want to thank all the viewers. Any question, any information, reach out to us. Our website is AuthenticCaribbeanFoundation.org. And stay tuned for much more to happen. And let's
Andrew, I want to say something before you go. My name is Lisa Harp. I'm also a member of the Authentic Caribbean Foundation.
Thank you,
and I
Lisa.
represent the island of Barbados. Thank you.
Thank you, Lisa, for coming forward. My apology. I'm a bit nervous. So thanks a lot again to everyone. We encourage our Caribbean community. We know that everyone is busy going from work to home. But it's important that we give back and get involved. It's very, very important. And I want to thank everyone. Thanks, Ambassador. Thanks, Dr. Nelson. Thanks, all the speaker. Thank you, team of Authentic Caribbean Foundation. Stay tuned and we will follow up with a report on this town hall meeting. Have a wonderful.
I have a response. I want to thank you all for doing what you're doing. I know I got on a little bit late, but I did share it on my Facebook page. I'm Afro-Caribbean American. My mom is from Jamaica and hails from Kingston. And yeah, I love you guys and keep on being positive in the Caribbean and sharing the Caribbean spirit and doing well. Stay safe, you all. Yeah.
Thank you. Thank you very much, ambassadors, team, everyone. Be safe.
Okay, bye-bye.
COVID-19.
Thank you. Bye-bye. Bye-bye.
Thank you.
Thank you, guys.